Welcome to the Rotunda, the longest-running maternity hospital in the world and the busiest in Europe. It has seen the birth of almost 1 million Dubliners, and some 24 new babies are added to that number every day.
Well done.
Congratulations.
It's a place of extreme highs and devastating lows.
Please cry.
Agony and ecstasy, all happening second to second.
Lovely little fella.
We're there for the most intimate of moments as people experience events which will change their lives forever.
Yeah, the baby's almost out, come on.
Events to be remembered and retold for generations to come.
Well done, you're okay. Your baby's nearly here. Oh, here we go.
They're very mushy looking, aren't they? Like, I don't know, they're like just all squashed up, especially the real chubby ones. But the little skinny ones are just gas looking, aren't they, when they just come out and their legs are flopping everywhere.
Arriving into the delivery suite are Jing from China, who works in retail, and butcher Christy from Santry. They're expecting their first baby today. Jing was getting pains when she was checked in the assessment unit, but she didn't think she was in labour yet.
The pain was constantly and get it dramatically, just get it seriously. And I asked the nurse, I said, could I get a painkiller? And she said, yeah, I give it to you. And could I check to you? I said, yeah, no problem. When she checked me, 4 finger already, said, yeah, go to labour. I said, oh my God, that's great.
Are you getting lots of pain, Jing? Yeah.
It's okay. It's only blood, it's okay. It's natural.
Oh.
You alright? Well, you're not alright, but I mean...
We met online,
We
actually.
actually met on a dating site, yeah.
Yeah, it's online. It's like
Asian.
15 years ago.
15 years ago, yeah. And then we just went to the cinema then and
Yeah, what's nature? Yeah,
Yeah, it just
nature.
clicked straight away kind of thing, yeah.
Yeah.
Well done, perfect. So can I have a little feel of your tummy?
Yeah, sure.
Okay, and you want an epidural, is that right?
I want to.
Okay.
It's too much.
Okay.
Until Jing became pregnant, the prospect of ever having their longed-for baby seemed remote.
We tried it for so long and it's not work out. I was on my private doctor all the time, did a check, scan. Even the doctor tell me, your time for 30 time is ready. So you do on the weekend or whatever, the date is ready. And still you not get pregnant.
How was the pregnancy then? Did you find it hard or?
We didn't know. She was 12 weeks gone, we didn't even know.
Stop.
We tried it nearly 10 years.
Trying, yeah,
Oh,
her cycle was
guys.
not regular. You thought you were gaining weight. She was actually in the gym, walking out, and she brought like this fit belt because she was putting on a bit of a small belly, and she was like pumping iron in the gym. And she came home and I was saying to her, she was saying she's getting very chesty. I said, I think you might be pregnant. I said, she said, no,
I
it
said,
can't be.
no way, can't
No,
be.
it
It's not
can't
yours.
be. I said, I think you are. So she actually just went into the toilet and tried. Actually got your pregnancy test kit in the Euro shop.
€1.50. I didn't spend too much money for my kids.
So she tried like 3 of them and they were all positive. First thing I heard was a scream.
I was like, Christy, come here. You know why I
You're in
opened my
trouble.
mouth?
You're in trouble. This is good. I was waiting for this.
Isn't that great?
It's mad,
Yeah.
Because you were saying to us they might have to do IVF for her, and we were saying,
Yeah.
no.
It's a big decision.
Yeah.
isn't it?
So we said, no, we'll just take a rest and then
Yeah.
God behold.
And here we are.
It just, just
here we
happens,
are.
yeah.
Have you thought of names for her?
Millie, yeah.
Millie. Oh,
Millie
gorgeous.
May.
Gorgeous. Ah.
Well, Millie Jing May.
Yeah, lovely.
Here's her second name, or her first name.
Oh, Millie's a lovely name.
All right.
Nearly there, nearly see that girl now.
Charmely. Charmely. Chinese, Charmely.
In Chinese, way Millie, if your pronunciation is called Mei Li. It's in Chinese, it's beauty, little gorgeous. You know, exactly same meaning. Yeah, pronunciation same,
Yeah,
similar as well. Yeah,
so
Mei Li,
Mei
Mei
Li.
Li.
You have children yourself now?
No, I don't know.
No.
Don't have.
I don't have them.
You said it was easy.
I will not have another one serious.
Yeah.
We meet a lot of people saying that, and
Yeah.
we see them coming back again.
Not again.
Yeah.
See how different you look?
You changed your hair.
I did. Got the thoughts.
It's lovely, yeah.
It's lighter as well, is it?
Yeah, just with some.
It's 30th of January.
It's time.
So I just want to summarise where we're at.
In prenatal, nurse and mother of one, Sam Kelly, is 6.5 months pregnant. She spent nearly 3 weeks as an inpatient.
Your second home.
Absolutely.
Still smiling?
Just about.
Our first child, Ollie, was born in August 2016 and completely straightforward pregnancy. So the second time round, I had got a scan and I was sitting looking at the screen up in front of me, and I know you said afterwards that you...
I was looking at the sonographer.
And her face was kind of... And she was kind of going... she was going a bit mad on my stomach, like, you know what I mean, going from one side to the other. And I was kind of like, oh, what's taking so long?
I was
Do you know?
waiting for something wrong here, but no.
And then she went, oh, so we've 2 babies.
Yeah.
So I think I just looked at you and went, what?
Unfortunately, the scan also revealed that this is an extremely high-risk pregnancy.
This is called a monoamniotic, monochorionic twin pregnancy. See the liquor here, the fluid around the babies, so you won't see a membrane because they're inside in the one sac. 2 peas in the pod there. Very rare, probably only about 1% of twins, so therefore we only see a few cases every year here at the Rotunda. An extra dimension of risk because they're sharing a sac. The term I used before is like a ticking time bomb where the cords can be entangled and therefore the cords could tighten and you have a significant risk of fetal demise of one or both babies. That can happen at any stage during the course of the pregnancy.
We only had a day knowing that it was
Yeah.
the twins,
Yeah.
excitement of that, and then the next day being told.
Yeah.
So
Yeah.
that excitement was cut short pretty quick.
It was just, it's not, I know it's never something that you want to hear, but just to hear, like, the way he said, he goes, Sam, this isn't the way we want it to be. You know, there was that excitement of there being 2 of them and everything was just gone.
So you can appreciate they're still moving a lot.
Yeah, I felt that.
which obviously means there's a risk of entanglement.
Mm-hmm.
Yeah. Your left-hand side. We see.
Normally I would like to think that we're quite positive people, you know, but I just, at that time, I just couldn't find that. I was like, what are we going to do when 1 goes or if the 2 are go, you know, that way? Because, you know, I suppose I see people every day who've lost babies and stuff, and I just was like, I don't know how I'd cope with it.
Alright, if I feel
Yeah, go for it. This one was transverse yesterday. I think that's a head, and then it was head down.
Yeah.
It's the other one. They were kind of on top of each other.
The risk of one or both twins dying has reached a critical point, so Sam's doctor has decided to intervene.
There's a spike in fetal demise from 32 to 34 weeks, and that's up to a 10% risk of at least 1 stillbirth between 32 and 34 weeks. So you're preempting that and preventing that by delivering earlier.
Today is D-Day. I suppose the babies are coming. Hopefully by lunchtime we'll be going over to theatre and we'll get the section started for babies to deliver. There's only so much you can see on a scan, I suppose. In the back of your mind, you still have this little niggle that, oh, will they actually be okay?
I'm Ellie and I'm 19 years old, and this is my twin sister Alicia. Imagine the 2 of us being midwives and actually delivering a baby together. Would it be actually probably the first twins to ever deliver in the Rotunda? Like midwife twins to ever deliver? I know, yeah.
In room 9, Jing is getting an epidural. From experience, midwife Jenny always keeps a close eye on the dads.
Sometimes birth partners pass out during the epidural being inserted. It's safer for everyone if the dad just has a seat.
Can I ask you just to sit, if that's okay?
Yeah, sure.
We had a faint here today, so we had a faint, so we just...
Christy's a butcher, so he's well used to looking at blood and different things that most people wouldn't be used to every day. Well done, Jing, that was
Super.
brilliant, yeah.
That's what the lesson said to me in work. He said, you probably faint or collapses now. Like, it's like clean a turkey.
I thought after epidural, the baby come out automatically. I swear to God. I thought after, great, just lay it down there, probably baby come out because 10 fingers open already, she come out. Eventually, I just relax a bit.
Your big deep breaths, well done.
Jing has become a fan of gas and air.
Brilliant. I just like I was drunk. After this, I can eat a big dinner.
After this, I can eat a big dinner.
To get you a roast.
Roast beef.
What would you like, Jing?
What do you want?
Chinese.
Want with chicken balls, isn't it? It relaxed you, didn't it, really?
Yeah, it making me happy, I have to say. Just like a fly, I was like, brilliant. That's a part of the labour. I think so, to gas.
Super. Well done. You're 8 centimetres.
Oh, God.
Fantastic.
Thanks.
You're brilliant. So just change that sheet. Just have a few bits ready. Just in case.
Just in case.
Yeah.
Quick.
She's been in a hurry all morning. I wouldn't be surprised if she's in a hurry.
Yeah, been out. Yeah.
See you later.
After months of anticipation, Sam and Liam are finally on their way to theatre.
Leading up to it, it was just the ultimate countdown. At least by then I knew, right, by 6 o'clock this evening, the babies will be here and hopefully all will be good.
Yeah.
We're preempting the situation and delivering prematurely. It's really a balance of risks. The risk of stillbirth for each baby is about up to 5%. So kind of a cumulative risk of one baby dying is about 1 in 10. And I suppose if there is significant cord entanglement, it justifies what we're doing.
Perfect.
Sam, I'm going to excise the old scar, like we discussed, okay? Sponge, please.
Waiting for the babies to come, the longest few minutes from the beginning.
So I checked for the position yesterday and twin one was head first. Hey. Of Sam. This is coming out. Hello.
9:14:59.
Do you know what you're having? No. Okay. Happy birthday!
There was a cry straight away, so when you hear that, you're like, oh, that was a big relief, you know.
Yeah.
Boy?
Yeah, a little boy is there.
And I know Richard kind of popped him kind of over the screen so you could see, oh, it's a boy.
No. Number 2 is coming to me. Leg first. There we go. There, that's one out. Hello. Oh, yes. Hello. He's vigorous anyway. Doesn't seem to be as noisy as number 1 yet, but he's, yeah.
Hello. What's going on?
Again, a lovely little fella.
All you could hear was the crying. And I know most people would be distressed by the crying, but I knew they're crying. That's a great sign.
Look at this. 2 cords, all entangled. It's like hair being plaited.
Oh, wow.
Yep. When you see the cords and the degree of entanglement of the cords, you felt that you got in there before there was a bad outcome. And therefore, from that point of view, there was immense satisfaction and relief.
Oh my gosh, like this could have been very different. You know, even like I got scans twice a day, and even to know that morning scan, it could have been completely different. You know, the space of an hour makes the difference with it.
Do you have a name?
We have 2 names left, but I'll wait till it's back to see.
Okay. Do you want to take a picture?
Yes, please.
Just want a good look at them now. A bit cuddle. You only get a quick look at them. No, happy and relieved.
Okay.
Is that number 1 or number 2?
This is number 1.
Number 1. Yeah.
It's going to be hard to give them both the same amount of attention.
Lovely. A relief, you know, to actually have them here and to be able to hold them as well makes a big difference, you know. Definitely. He calms me as much as I calm him.
You can try with the fringe. I was going to. I don't know what to do.
Try.
So afraid in case it's awful.
No. Well, you should ask.
Back here with 40 minutes. What are you doing?
Put the fringe. Try to see how she will look like with the fringe.
You look like my 16-year-old self there with the side fringe.
Yeah, just turn around to me.
It was bad, yeah.
We might examine you, Jing. Is that okay?
Yeah, of course. Millie, wiki, baby.
4 hours after arriving in the delivery suite, there's some news for Jing.
Jing, I thought there was a little bit of cervix left, but it's your baby's ear. I could feel. That's
a big ear,
So you're fully dilated, okay?
How big ear?
She touched your ear and she goes, "Oh, I think that's an ear or something." I hope it's an ear. It's a baby.
Don't pull my hair, my kid's ear.
She'll be able to hear you.
Yeah.
She's a little piggy, Christy.
She's a little piggy.
She's a little piggy.
Because
Chinese
New Year.
Just,
yeah, you're the
little
pig.
piggy.
Yeah.
You're the pig. Yeah.
My mum's the ear of the pig, and I
she?
told her, and she got insulted. My mother, she was insulted. She was like, "What are you trying to say?"
It's a very lucky,
Is it?
very lucky year.
It's a very
Yeah.
lucky year.
It's baby boom in China this
really?
year. Yeah. Oh God.
Everyone wants a year of the pig.
Yeah.
She had progressed really fast. We would expect people to go a bit more slowly, especially on their first baby. But Jing bombed it from when she came in.
Super. That's it. Keep going. Big breath in and big push down again, Jing. That's it.
Oh, brilliant.
Well done.
Super.
Keep going, Jing. Well done.
Jenny told me we'll be taking average 1 hour and 1.5. I was like, oh my God. I said, no way. I do my best. I will do my best.
Well done. You're doing great. Right, and one more push if you have it. Big strong push. That's it. Keep going.
I was actually looking at her head and her face gone really purple, and I was going, "Oh my God, strong woman there." And you just see the willness in it, just to, the fight you could see in it. Yeah. Same.
I don't want to
I was
baby
actually talking the
suffer,
same. Fair play. You're doing great, jeez.
Yeah. Keep going.
Yeah.
Well done.
That's a good one. That's a great
Well done.
Great stuff.
Super.
And have a breather, okay?
No.
The Rotunda is like a big family. We'll probably fight a little bit like brothers and sisters sometimes. More often than not, like, we're a happy family. At the end of the day, we'll all probably, laugh about it. It's a testament to the amount of people that are here years and years and years, and I'd say I'll probably be walking out of here with a Zimmer frame.
After 10 years trying to have a child, Jing and Christy are minutes away from meeting their daughter for the first time.
Oh, sorry. I'm tired.
Hard work.
It is. I can imagine.
Is it here?
I just grab a bit of baby's hair there, and then the head won't disappear. It's more of it staying out between contractions. That's another sign.
You're nearly
that
there.
we're not far away at all.
Yeah.
He was, trying to calm me down and hold my hand. I said, leave me alone. Don't even touch me. Don't even near me. Let me enjoy first.
Heads out, baby.
Well done. Super.
Amazing.
Really push him. So the next time you have a contraction then? Yeah. You just push again.
Gorgeous,
okay?
baby. Gorgeous.
That's her ear that I was feeling earlier. Doing big breath in and a big push down. Well done.
That's it.
That's
She's
it.
nearly out now, baby.
And
She's
breathe.
out.
And breathe.
Wow.
Hello, lovely.
Wow.
Now, Baba. At 14:24. Let's give you a roll. Hello.
Oh my God.
It's okay, it's okay, it's okay.
What am I doing today?
It's okay,
She's
it's
perfect.
okay.
Hello,
She's just-
lovely.
Oh my God. She look like me.
Yes.
Hello, lovely.
Gorgeous.
Oh my God.
Now, lovely.
Oh. Hello, Millie. Hello, baby.
Millie.
Talk to Mum.
Millie. You best girl. Mommy love you, baby. Oh my God.
Thanks.
Little Bobby. It's okay, Millie. It's okay. Daddy and Mommy. Millie. Shh. It's okay.
She's lovely.
Yeah, it was mad, I have to say. I was obviously about that. I was mad. I couldn't believe it. Sometimes when we come
happened out of blue,
and I
yeah.
see the baby beside me, I was like, that's my baby? Oh, okay.
Oh my goodness. You're a big girl, aren't you?
Honestly with you, it's like a dream.
You look like me, Christy.
Like complete, wasn't it? It was like
Yeah, no, I
we're
feel
missing
it.
one thing.
Yeah, no, it's like for me, it's like still in the
There,
dream.
yeah.
Oh my God, I can't believe this. Hey, baby. Are you okay? You sleep?
We were wondering what the mix would be like. Obviously, you know.
Yeah, what the
I knew it would be dark
eyes,
hair. We were
yeah.
saying I was saying it would be brown eyes, and she was now blue. And she was like me, said you probably have your lines on your forehead or your freckles,
double chin.
or your freckles or your double chin.
I she got everything. Oh, Bertie doesn't get everything.
She got a mix of both.
Oh my God.
It's like daddy's hat.
hands.
Oh my goodness.
Mammy's little nose, cute little nose.
Oh my God, my nose, Jesus.
Why?
Bottom nose, no nose.
Stop.
She don't look like daddy at all.
I don't know. First thing, straight to my chest. Hold it there, just staring into her eyes, you know. Just call her name, wasn't it? Yeah, Millie, you little gorgeous. Daddy's little girl. Yes, little princess. Jing actually thought that she'd never have the baby. I actually said, we will, and she said, no. So I kind of just said, okay, we won't. I just stuck with that one, we won't. But then in my own head, I said, we will. I just had a feeling. Like mission complete, it's like mission complete, isn't it?
Yeah. Mission Impossible.
Missing Tom Cruise.
Yeah,
I'm not Tom Cruise.
But now I have to learn how to be a parent, you know, for me. I don't even know how to change a nappy. I swear to God.
The Rotunda have a lovely tradition that the physiotherapy department organise the annual children's Christmas party. One year we had to move the date and the secretary sent an email out to the whole of the hospitals giving them a date change and saying that she hoped it didn't cause too much incontinence instead of inconvenience. So that gave us some very funny return emails by reply.
Mother of one, Ugo Cinieri, is 30 weeks pregnant. She's having a scan in the ultrasound department with consultant Michael Geary.
The weight is so much.
I know.
At an earlier scan in her home country, Nigeria, she was told some unexpected news.
The nurses were like smiling when they were doing the scan. So I said, what's the problem? They said that they want to show me what they are seeing. So they turned the screen to me and they were counting.
So there's number 1, that's the head, as always, in the same position. The little guy down here, he was probably the smallest last time around. This is number 2. There's number 3's head.
My early days was something else. I thought I could die. I was so lean, I wasn't eating, nothing goes in. If I drink water, I'll throw up. Multiple pregnancy is something else. It's out of the world. It's an experience that you can only imagine when you are in it.
So you've got about 4.5 kilograms worth of baby in there, which is why you're feeling very uncomfortable. So that's 10 pounds worth of baby. So that's a lot of baby in there. Yeah. Okay. I need to talk to our paediatricians about the timing, but probably 33 weeks on the 12th.
Yes.
Okay. It's a lot of pressure, and no doubt you are uncomfortable. With good cause to be. Moving around from A to B, it's a major strain. So getting up from sitting down is very difficult, and she needs a lot of help. And right now she's another 3 weeks or so, maybe 4 weeks of further growth.
Ugo Chinyere left Nigeria in difficult circumstances. She's now living alone in an asylum reception centre in Dublin. Her husband and her daughter are still in Nigeria.
Is your husband coming over?
I pray so.
So, has he got a visa to come?
No.
Okay. Do you have anybody here with you family-wise?
Oh, no.
Okay. And then you've one other little one at home?
A daughter.
A daughter. What age is she?
10. I don't know how to cope without him when I'll give birth. And I want to see my daughter. And I want to hold her. Because this is the first time she's separated from me since birth.
I'm not traipsing over again.
It's only across the car park.
I'm about 60 years of age, going on 61.
You're fitter than most 40-year-olds, for God's sake.
Mary,
Do you want me to make a phone call for you?
Mary, I beg your pardon now. I'm older than Yana, I could do it.
Put that in your pipe and smoke it.
Expecting their third child, Jade and Keith have been in the delivery suite annex for 24 hours, hoping that labour will at last start properly.
Our pains, when they were getting closer and then they were getting further away, I was like, right, come on, out and do a few laps of the stairs. She's up and down them stairs. She was doing squats outside at the lift.
I was lunging on the stairs and, yeah.
Trying to bring her on a little bit quicker.
And I had a bath as well at one stage. I think that was the nicest bath I ever had in my life because I couldn't fit my own bath at home for the last couple of months. I was too big.
Our pains were getting closer and then they were getting further and I was like, oh, come on. And then they were getting closer again and I was like, lovely, happy days. Then they were getting further apart again. I was saying, is this ever going to come?
Come about 7 o'clock in the evening, they said they wanted to send them home because they didn't think there was going to be much movement and it was just panic stations then. I made a fuss when I got the pains then. And they checked me then and moved me into the labour ward then pretty quickly.
How are you feeling?
Brutal.
Okay. That's it. Big breaths in and out.
We met when I was 17 and we're together now nearly 12 years.
Make the room a bit nicer for you there.
I palled Keith's sister for years and then he chased me for a few years actually. Didn't he?
Just keep breathing, no, no.
Oh!
Breathe, breathe.
Please stop telling me. Oh!
She's gorgeous.
He's looking to get into the good books now.
Now you must be tired after all day in here having pains.
Yeah, I'm knackered.
She's been doing great.
He doesn't take Aunt seriously. Everything's just a joke and a laugh, isn't it?
Yeah.
Yeah, be on the gas. Big smile on your face.
More relaxed. You have to let a lot of things that he says just go over your head because he doesn't mean any harm by what he says. He just hasn't got much of a filter between his brain and his mouth. But yeah, we have a bit of crack, don't we? You have to be very light humour to live on.
Just 1 hour in the delivery suite, Jade's pains are intensifying. Having not had an epidural on her last 2 babies, she's trying to deep breathe through the pain.
Lots of pressure. What weight are the babies?
9 pounds, really. Over. She throws big fouls.
I didn't feel in control, although I knew, I kept telling myself it's only going to last for a couple of seconds and then it's going to pass, so like you've done the last one, you can do it again. But no, I didn't feel in control of the pain at all, no.
Yeah, she was doing good, yeah. She's doing good. She had to stop holding her breath. That's what I was saying to her. Breathe, breathe. You can do it.
I don't know if I can.
You can, you're already doing it, Jade. You're doing it.
I'm sitting here all day and my tooth is at me. You can do it.
Oh my God, did you hear that? It's a man's world. I'm going to rob that arm if that's okay, Jada, while there's a break in the pains.
So much easier for them.
Be well able for it.
No, you take to the bed for a week when you have a snotty nose. I don't think so.
I'd say I'd do it.
I don't think so. Have a rest.
What?
Have a rest.
Oh, thanks very much.
It's actually like having a toothache. You don't want anybody to talk to you. And Keith just kept saying, just breathe, just breathe, just breathe, and it was getting on my nerves. He's trying to help, though. He was trying to help.
Hello. What's the story, Isa, alright? No, Isa, I'm in the Rotunda there. No, you're alright, No. Yeah, just waiting for the baby to come here, Isa. Cheers, bud, yeah, nice one. Right, go on, I'll talk to you in a while. Right, go on, baby.
So much pressure.
Good.
I'll be moving down a little bit further.
Definitely. It's great when someone's not got any kind of major pain relief on board and it's not their first rodeo, so they're able to turn around and say,
I need to push.
Great. That's it, Jade. Well done. So that makes our job very easy because chances are she's 100% right, and that gives us time to get our gloves on, get ready, and you just let it happen.
Well done. Open the legs. That's it. Well done. Go for it. Well done. You're okay. Yeah. We can see some of the membranes there. Come on. Not far to go. Brilliant.
Pretty much 10 centimetres. Very little cervix left. 9.5. All right, you'll push that away. No bother to you. Okay.
You're okay, Jade.
There is times that you think, oh, everything's fine. And it's the one time if you just kind of go, oh, this will be grand this time. And that's the one that'll catch you out. You can.
Now 33 weeks pregnant, Ugo Cinieri has been admitted to have her triplets. Pregnancy has been long and difficult, but there have been some upsides.
The kind of attention I get is something else. Even if there is a pregnant woman there, it will be as if my own is a special case. You know, they attend to me immediately. Everybody will be like, wow, 3. I feel safe. I feel loved. Yeah. That's how I feel. I'm just trusting God because I'm a Christian and I have total trust in God.
People hear the news of triplets. It is very exciting. It is also scary. When you have babies born at 33 weeks, there's a possibility they may not handle that switch over to life outside the womb very easily.
Whenever we prepare for babies that are born preterm, there's always a high level of uncertainty of what to expect. Babies that are born this early usually do very well after birth, but some of them do run into breathing difficulties because of their lung prematurity. So we're always prepared for the worst, but hoping for the best.
Alan, I'm just testing there. You doing okay?
Look, you can put your hands on.
Quite thick, isn't it?
Yeah.
A bit of a stretch there. Stretch coming up now, Ugo. Right, we're good. And push. And here comes number one.
Here, 53. Divine, 1183.
So, I'm going to show him to you. There he is, little boy. What's his name?
Divine.
Divine.
Welcome to the world, Divine.
He's lovely. When I delivered the first baby boy and I heard the name Divine, I paused for a second thinking, does she think that this is a girl? Because instantly I think would associate it more with a girl. But why not a boy? You know, why not? Yeah.
Welcome to the world. 1155, baby Diamond.
Diamond, okay. Here's Diamond.
Welcome to the world, Diamond.
He's a noisy one. The second baby arrived and he was a boy, and then I heard the name Diamond and I thought, does she know this is a boy? And of course she did. But again, instinctively I would have thought that Diamond would be more associated with a girl, but why not a boy?
Hello, Diamond. Take that.
Okay, 2 down, 1 to go. There he is. Now. And
Darren.
Dara.
Look at Darren.
There he is, okay, let's get. And then the third boy arrived and he was called Darren, which is very typically a boy's name. So Divine, Diamond and Darren.
And Pink as well.
3
Second
Ds.
baby and third.
Ugo, congratulations, well done.
Okay, just moving. Divine and Diamond, the first 2 babies that were delivered, thankfully were quite good. They both cried after birth and they were both quite vigorous. His colour's not great. Do we not have sats on him? Can we just try and get his colour's not great? Darren, however, it was becoming obvious that he was struggling with his breathing. He was breathing fast. The level of oxygen in his blood wasn't rising at a speed that I was expecting. Here, hold that for me if you don't mind, Angela. We decided to intubate Darren, which means passing a tube down his windpipe or trachea to help with his lung immaturity. Just let go of the crical pressure for a second. It can be very difficult in the heat of the moment to pass a tube down a very small airway. You're talking an airway that is a few millimeters in diameter in a baby that's under 2 kilograms in weight. So this procedure is tricky. We need to do it quickly in order to stabilize the breathing. Yeah. Okay. Take that off. Thank you. Darren, we needed to pass a tube to help him breathe because he was just getting a little bit tired. Then we gave him some medicine through the tube into his lungs to help mature his lungs a little bit quicker. So you're not going to hear Darren cry. You're just hearing Diamond cry at the moment. Okay?
Go first.
He's intubated now. Does he need surfactant still, yeah?
He's on 30%, but he's working.
Is he working hard? Thankfully, Darren recovered very well, very quickly, once we secured his airway and gave him a medication called surfactant. And because he responded so well, we were able to remove the tube and give him a chance to breathe on his own.
Ugo Cinieri is visiting her baby sons, who are now just 24 hours old.
Darren boy, how are you? It's amazing. They're doing so well. I heard he's the one that eats very well. Baby Divine. It's amazing.
He was the first one, right?
Yes, he's the first.
He's the smallest.
He's the smallest.
Yeah,
Very strong. I feel relieved, at least from the pregnancy. But I know I'm entering another stage. This time around, feeding them, especially once they're out of this place. You know you're your own to take care of them.
Back in room 9, Jade's baby is showing early signs of distress.
Breathe, okay? It only takes a minute or 2 minutes of something to happen with that baby's heartbeat and things can take a drastic turn. Now Jade, after the waters broke there and all that pushing, the baby's heartbeat is a little bit on the low side, okay? What we're gonna do is get pushing properly, okay? Which means try not to scream if you can. Push down into your bum. Really long, really hard. Look, the head is just there. Big long push. Come on, big long push. You're always wondering there could be a baby that mightn't come out roaring, crying. So you just have to be ready to act on that. Pull those legs up towards you. Big long push. Come on, big long push, big long push, big long push, big long push, big long push. Well done. Well done, Jade. You are so close here. She is nearly here. They're nearly here. Nice and slow, nice and slow. Blow. Well done, blow. Well done. Well done. Head out over roar. Jade, your baby's nearly here. Okay, where are you going to turn, baby? Which way are you going to turn? Inevitably, yeah, there is that kind of, until that baby's out and crying, yeah, you're going to kind of hold your breath inside. Okay, let's go. Open the legs. Give me a big, big, big push down.
Go on, push. Go on.
Well
go
done.
On, go on. Go on.
Look down.
Go on.
Look.
Go on.
Look. It's number 3 girl at 5 past, and she's a biggie. Well, hello. Well done. Now you better watch your wallet, Keith, huh? Well done. There she is. Hello. Hello. Well, your mama is amazing. Is she crying? She did give a big cry. She's just like, what's going on? Like you, she's a bit tired. Huh? Don't worry, she'll give a cry now. Hey, where are you? Huh? Now. There she goes. There she goes. Huh? Oh, look at you. Now you've two sisters that are dying to meet you, I'd say, huh? Well done. You okay? Well done. Now, we're all a bit of a mess here, but don't worry. Well done. Oh my God. It keeps coming.
She's holding her breath.
She's grand. Don't worry. She's lovely and pink. She's there. Giving it socks, huh? Now,
Hello. Hello, gorgeous. I really thought you were a boy. No?
I was just delighted seeing her coming out, no complications. She was healthy, and I think the eyes started welling up a little bit. So.
Now, do you want to do the honours, Keith? Did you get to do it before?
No.
No.
I never did.
Give it a big chomp. Just go for it, go for it. I'm protecting her. Yeah, go, go, go. Chomp, chomp, chomp. And again, yeah. Lovely. Done. Thank you.
We're going too fat and grizzled.
You're supposed to say it feels amazing.
Oh, yeah, well.
I'm getting rid of you after this
Feels
interview.
Feels like cutting out nails, doesn't it?
You're probably not done, are you? You'll be back again.
No.
Oh, that was very quick.
I'll have no more kids. No, 3 is enough.
3 is definitely enough.
Your ma didn't believe me. Hello.
3 of them were surprises, weren't they? You didn't plan any kids.
Lovely surprise.
Mummy had the baby. Ask the girls, do they want to know what it is? Do you want to see what it is?
I want to know, but I don't want to know.
Well, here, you have to go shopping anyway, so do you just want to know?
The girls do all the boy stuff with him anyway.
Yeah, the
Like,
girls-
he's into horses and everything, and the girls do all that with him anyway. So they don't let him leave the house without them, without one or the other.
Yeah,
He doesn't
can't
get him
without
in
one,
it.
yeah.
They probably spend more time with him than they do with me.
Say hello to your big sister, or your little sister.
What weight?
8'11".
Becca.
Yeah. It's a big turkey, isn't it?
What?
It's a big turkey.
Oh, yes. What's her name? What's her name, Mommy?
Well, I got the other 2, Aaron and Amber's names on the back of my neck when they were born. But I went and got that the other day for Bunny.
Do you want to say thanks to the midwife that delivered your little sister? Say thank you. Get that woman some flowers. Right, go on. I'll dress her and I'll take a proper photo and send it to you now shortly, right? Thanks. Bye.
Welcome to the Rotunda, the longest running maternity hospital in the world and the busiest in Europe. It has seen the birth of almost 1 million Dubliners, and some 24 new babies are added to that number every day.
Well done.
Congratulations.
It's a place of extreme highs and devastating lows.
Please cry.
Agony and ecstasy, all happening second to second.
Lovely little fella.
We're there for the most intimate of moments as people experience events which will change their lives forever.
Yeah, the baby's almost out, come on.
Events to be remembered and retold for generations to come.
Well done, you're okay. Your baby's nearly here. Oh, here we go.
Remember my first birth? I didn't know what to do.
I didn't know where to look, what to say, to laugh, to cry, to vomit, to faint. I didn't know what to do, but like, it was amazing at the same time. I remember going home and being like, oh my God, like, saw birth.
Arriving into the Rotunda delivery suite for their first baby are teenagers Savannah and Brandon. The first time they met, it was like an Irish take on West Side Story.
We met on the beach in 2013. It was the fight on the beach.
I'm from Ballymun, then she's from Coolock, and they don't get along, so there was a big fight, and then she seen me and she goes, oh, you quickly run. It's a weird first time, yeah.
It was up and down, breaking up, and then two years ago,
Yeah.
we got back with each other for Papa, and that's...
It's been consistent then, yeah.
Until women are in established labour, they stay in a 5-bed ward next to the delivery suite called the Annex. With only curtains between the beds, patients are intensely aware of the other labouring mums around them. After 36 long hours in the Annex with little sleep, Savannah is at last on the move.
One of the midwives had examined her out there and she'd got to 3 centimetres. I think she was really, really relieved because she'd been there for a while.
I'm surprised. I thought I was gonna come in like,
Yeah.
like, cause the girls I saw, like from the 2 days that I've been here, the girls that I've seen that have came in here are just all screaming.
Really?
I was like, oh my God, I'm shitting.
But it just depends. People react differently.
And then mine was just like, I just started crying.
I know. Well, that room can be very scary. And the thing is, you don't know what's going on with anybody else. Like, there could be something else other than just labour going on with them.
So younger mums, they have a lower incidence practically of everything. I suppose at that age, your body is really built to have babies, you know, to go through childbirth.
That must be an old fashioned.
This is, yeah. So in one respect it is good, but also, yeah, I suppose socially being a young mum is difficult and it is tough.
4, 5, 6, 7, 8 pencils. I really wasn't expecting it.
Where's Savannah? Savannah, Mandy.
She's just in room 9.
All right, perfect. I just walk in,
Go
yeah?
on in, yeah.
All right,
Just
thanks.
knock on the door.
Yeah.
Can I come in?
Oh, hello. How are you?
I never looked after myself. You know, like my mum would have to remind me if I had any appointments, or she'd have to wake me up to go to school. I never cooked or anything, but then I started to cook for myself and all. Then when I said, right, I can start doing things for myself, I says, right, now be ready to look after someone else. Can you send juice before the 5th of February ends? Because my birthday's tomorrow.
Is it? Oh my God. What age are you going to be?
19.
Oh my God.
Yeah.
Oh, that'd be cute though, no?
Yeah.
The 2 of you are the same birthday, yeah.
No, he can have his own day. I'm only messing. He's worth it.
This is my new little technique. Some fun pressure?
Actually, just do a massage here because it's work. No, but just do properly, please.
Very demanding.
You had a caesarean section before?
Yes.
Okay.
In theatre, Sinman is being prepared for the arrival of her second child at 35 weeks gestation. Just hours ago, she came in for a weekly scan, only to be told she has to undergo an emergency caesarean section.
I told them about a stitch I had this morning after breakfast, and just as a precaution, they're afraid that the uterus might be kind of weakening.
Have you got somebody coming in with you? No, just me.
Her husband Ian is on the other side of the world, in Miami on a business trip.
Yeah.
I flew out on the Sunday and I woke up to a text on the Monday it was when you were getting all your scans and stuff done, saying, guess where I am? And it's like, what?
Great. So we're just going to let that dry, okay? And whenever that's dried, then we'll cover you over, then we'll check again. We were just chatting about the scar, and we're going to go through the scar that Oscar was born through. Okay.
Sinman and Ian had their first child, Oscar, 2.5 years ago. At their local maternity hospital, they first heard the news that he has the fetal abnormality, spina bifida, which affects bowel and bladder function and can leave the child with little or no ability to walk unaided.
Where we had the 20-week scan, and we knew that was the day that we could find out whether it was a boy or a girl. It never occurred to us that anything could be wrong. And then people were asking because they knew that we were finding out whether it was boy or girl, and that we were on a scan because I had to leave work early. So we were getting the messages then that evening. But I ended up just texting one group of kind of close friends and getting them to kind of spread the word. We were kind of also kind of offered, you know, there were kind of options abroad that we could think about. I think the fact that that was kind of mentioned kind of made it worse, because it was like, is it just kind of a situation where you would consider that? So once we started researching and just seeing all the children who have spina bifida and are happy, and you wouldn't change them for the world. So it was literally just, say, about a week of
horror,
trauma. Yeah. But after that, like, we haven't looked back.
Sinman and Ian's new baby has also been diagnosed with spina bifida.
We had had a chat before saying, okay, well, what if we got another diagnosis?
Yeah.
So we'd kind of gone through all the scenarios, and we were like, okay, no, we'll be fine with it because, you know, Oscar turned out great.
Yeah.
And, like, we're really happy with him.
Kind
It
of
wouldn't
sick.
change him at all. So that would be fine.
Yeah, we were saying, like, if it's another spina bifida case, is what we're used to. So it's just,
Yeah.
it'll just be another baby to us.
3 months ago, Sinman was only the second Irish patient to undergo pioneering surgery in Belgium, in which her baby was operated on while still inside her womb. The hole in the baby's spine was closed before nerves could be further damaged, giving him a greater chance of being born with normal body function.
That's the spina bifida, and the nerves are exposed here on the back. This is the extent of the lesion, and it was about 3 centimetres wide, so it was quite a wide lesion on the lower back. Once they had repaired the nerves and covered over the nerves, they then created a skin flap.
The procedure will bring Sinman's baby benefits in the long term, but the doctors are concerned that it carries risks for mum and baby during pregnancy.
There is a scar on the uterus that needs to go through the stages of healing, but the uterus is growing as the pregnancy is advancing, and there are considerable risks associated with that. That scar can weaken, or indeed can even rupture.
Okay. How are you feeling there, Sinman? Great. So we just started. So it'll be a couple of minutes before this baby is born, okay? This blue area here of the stitches that they used whenever they were doing the surgery back 10 or 11 weeks ago. You doing okay there? You feeling all right? Yeah? Excellent. Okay. It's very thin there, isn't it? It is. Do you know what? I think I'm just going to go in just above that. Yeah. Okay. So there's the waters are gone.
So we couldn't take the chance, given that Sinman complained of some pain, and therefore it was time to meet Rufus.
Now, hello there. Hello. So do you want to hold up, baby? Now, here we go. So now, got him? Hello. Oh, here. Look. Hello. How are you? How are things? He looks great, doesn't he? He's gorgeous. Lovely. Congratulations. He looks fantastic. Now, hello, Rufus.
An examination of Sinman's empty womb will let the doctors know just how close she was to a ruptured uterus.
Whenever you feel inside, you can feel that there is a bit of a defect, but it hasn't gone all the way through. So that's good. So that's great. That was our worry today. Yeah. Give him a few kisses. That's brilliant. He's gorgeous and he looks big.
Small.
I know. And I'd say he's, because we said what this morning about 6'14". I'd say he's not far off that. Yeah. I look interested to hear now what weight he is. Yeah.
New baby Rufus has to go to the intensive care unit for ongoing assessment. But before that, he gets to meet Mum for the first time.
We really wanted to kind of get off to as good a start as possible. So skin to skin was really important to me, so I got that.
Hello.
If I had €1 for every teen toast that I have given, it's just, and I do tell them it's better than a roast beef dinner. They love the teen toast. Well, would you believe it? My husband took mine on me when I had my son, so they had to make me another bit. Well, I have to say he had a rough time now, in all fairness as well, because I nearly bet the hoo-ha out of him, you know. I was a bit stressed.
In delivery room 9, Savannah has opted for an epidural to help with the pain.
He thought it was easy. He was telling me, get no painkillers, go normal. And I was like, I can't stick this pain, like it's really sore. It's not you having this baby, it's me, like.
I thought it was easy. I thought they were just reactions the girls put, you know, an overreaction of screaming.
Yeah. Yeah.
Thanks, Margaret. So, Savannah, this is Margaret. She's going taking over your care.
I probably am a little bit more motherly to the very young girls. Probably bring that into it a little bit, because I'd be very aware of how my own daughters might have been at that age and how they might have felt had they been in a similar situation.
The hardest part of labour is sometimes getting into labour, especially when it takes a long time like it did for you. So you've done really well. You need to be really proud of your achievement.
Yeah.
I don't want to bring the dog here.
Ready in there, yeah? Pyjamas and that.
Shower cream. Oh, the midwife, would you think these pads are big enough for
No, absolutely not. This is your first line of pain relief, okay? This little button here, okay?
Yeah.
Because now that you have the epidural, we don't want labour to become too prolonged.
Yeah. My life was alright because my man now was on drugs, but now none of them's on drugs, so it's alright now. It's gone now. Living with me nanny and then all my aunties and then calling them my sisters. That was alright.
As my dad left us when I was 6, he said he was going. I seen him getting in the taxi, and then he goes, "Oh, where you going?" He goes, "I'll be back," and then he left. But like he still stayed, like, you know, staying supportive of me and my sister. He just didn't want to be with me mad. But whenever I used to get in trouble in school, she'd tell me that, and then he'd buy me something, you know, buy a flick or a PlayStation, whatever. He'd spent more money than time on me and my sister.
Okay, well, you go for a cup of tea. Will you keep an eye on my trace? I will. Her oxytocin is due up at 10. Okay.
So what would we name the kid?
Carson.
Right, we have Carson. What if he doesn't look like a Carson?
It is called Carson.
But what if he looks like a Benjamin?
Someone said to me,
Yeah.
call him Jeremiah. Jeremiah. I said, no. I can't call him that.
Baby Rufus is 24 hours old. After the radical surgery he underwent to correct his spinal cord defect, only time will tell what level of disability he may have in the future.
Good boy. Oh, this looks lovely. So this is the little
area where the spinal cord would have been coming out. So they put a little patch there, and it's completely closed over now and healing very nicely. You can see he's got lovely leg movements, so that's what we like to see, because children who have spina bifida sometimes can't move their legs very well. Whether he needs assistance with a walking device, it's too early to say, but we would be hopeful that he would get up on his feet and be able to walk, which is great.
Definitely brought us closer together. Like
Yeah.
when all the kind of even through like the toughest times.
We know each other fairly inside out now, so that when you do have those bad times or those lumpy times, you know, we're able to, you know,
see beyond it.
See beyond it.
Rufus is being moved to the nearby Temple Street Children's Hospital for further assessment. Sinman will have to stay in the Rotunda for a couple more days to recover from the C-section, but she hopes to visit him later.
Will you see Daddy tomorrow?
I think they're amazing. I think they're an incredible couple, and their children are incredibly privileged to have them as parents. They have put everything into this and accepted everything and accepted all outcomes. There's no rule book that tells you how to deal with these situations, but they're an inspiration.
I know, it's just a lot of machinery. I'll see him in a few hours, that'll be grand.
Congratulations. He's gorgeous.
Well, Savannah, you're 10 centimetres.
Oh. From
10. Are you sure, Mark?
Are you doubting me?
It's 12 centimetres, isn't it?
No, it's 10.
No, like 12 centimetres is the delivery.
No, 10 is the delivery, okay? 10. They displayed a lot of innocence, but enthusiastic innocence about the events that were happening. Your baby's head needs to come down a little bit further. So what we usually do is we usually wait for an hour after you're 10 centimetres, then start pushing then, okay?
Yes.
It's getting worse.
Yeah, it's obviously the baby coming down.
It's like I need to have a shit.
Yeah?
Yeah.
That's exactly what it feels like, pet.
Oh. You want to try this?
Okay.
Quick, hurry. Breathe into it. You know?
What? Savannah, that's weird stuff. Savannah, that's weird. Yeah, I tried the gas, but I didn't like it. Nah, I don't know how the girls can take it. It's not a nice feeling.
I love you.
I love you too. Use the gas mask.
Use the gas, pet. That's it. Well done. Come on.
What I tell her to come down to.
One of the first babies I ever delivered, the baby's dad worked in Copperface Jacks. That baby is one of the only babies that I get to kind of see grow up, because every time I'm in Coppers now, her dad shows me pictures of her.
7 hours after arriving into the delivery suite, it's time for Savannah to get into position to push.
You hold my legs up like that.
Savannah, I don't know what your nanny told you. This is not the 1950s. I can't touch you when you're doing this.
You can't, you're...
And push again. Right down into your bottom, really hard. Really hard, really hard.
At the start, it was like watching TV or something. So I was just looking, you know, like watching like Nature Channel or something. So I was just looking, right, how does this happen?
Come on, again. Do you want to sit down?
Can I not look?
And again.
The dads may or may not find that they want to look or not look at what's happening. I think Brandon was actually very enthusiastic about looking. I think I had to kind of suggest to him that he'd be better off at the top of the bed.
Hands in there. Big breath in. No, Savannah, take in a breath and hold it.
I just looked at her as like a ma or something, you know? Don't do this, don't do that.
Come on. No, come on now, don't lose it. No, come on.
I can't.
Okay, Savannah. Savannah.
Go away!
Savannah. Stop. Come on, Savannah. No, don't shout at me.
I'm sorry.
Yeah, I know you don't mean to, but listen to me. Listen. Those last two pushes were fantastic, okay? That's the kind of thing that will have your baby out, okay?
It's too many. I can't do too many of them.
All I'm asking you to do is 3 with each contraction.
Oh. Legs for a minute.
That's all right. That's okay.
No, I don't want that.
Right, okay. That's it. Good girl. So when you get your next contraction, you're going to give me a big push, okay? Just like the last ones. You ready? Right, big push down there now. Open your eyes, look down. Hello.
Great job.
It's all just a different love, like you feel at first sight.
Yeah, can I just walk out or something?
You want to leave the room?
No, don't.
I just got emotional and I ended up having to leave. Like, you know when you're about to cry, you get that feeling. That was in my whole stomach, so I didn't know what to do. I felt like there was too many emotions in that room. Talk to you instead, please.
Sorry?
Can I talk to you instead?
Congratulations.
Yeah,
You all
it's
right?
too emotional.
Congratulations.
Yeah.
Oh, no. No.
No.
No.
Did you not believe in yourself? You should believe in yourself. You've done
Oh,
it.
baby. He's so big. He has so big hands.
He's a big boy. He is, yeah.
Yes. What do you want to go with?
I don't mind.
Carson?
Yeah. Oh my God, and you just got him 12 minutes before my birthday.
Oh, no.
I was even afraid just to even hold him, you know, just don't want to do anything. Just leave him the way he's perfect at that. Yeah. I just felt blessed, I just felt happy and all, you know.
I think it's great because not many people, dads or anything, do stay around like that or look after the baby like that.
Well, you're my boy, aren't you? Oh. The same type of dreams you'd have for every kid. You know, just like them to be better than me, you know, brought up in a better neighbourhood, just, you know, not as lazy. Yeah, I just hope he be better than me.
Well, someone once told me before, they said never have a baby, it's like someone has a steel pole and they're biting it off you. Now, after that description, would you ever have a baby? Because I don't think so.
In fetal assessment, Carrie and her boyfriend Finton are in for a 37-week scan. Although this is their second child, babies weren't on the agenda when they first met.
I kind of would have been at a stage probably like, God, I could never imagine myself having any kids. But like if it happened one day, like it was fine. But I didn't think that I would be 22 and on my second baby. And then obviously things didn't go as they kind of were supposed to.
This pregnancy is progressing normally, but less than a year ago, Carrie and Finton were told their first baby, Ellie, had a fatal fetal abnormality and was unlikely to survive after birth.
We went back to my house then and we just sat there for the whole day really, just basically crying. And then for every day after that, probably the same thing.
Couples have the option to continue a pregnancy or to interrupt the pregnancy, and every couple comes to it with different values and different life experiences, and our job is not to judge, just simply to provide the information and to be as supportive as we can. You see her wriggling around there now? So, had a look at her heart a few minutes ago. So here you can see the 4 chambers beating nicely.
You've done very well in Paris.
Now 37 weeks pregnant, Carrie is past the point at which her last pregnancy ended. Back then, despite the likely tragic outcome, they wanted the pregnancy to continue as long as possible.
I said to Finton, I said I would literally be pregnant for the rest of my life if it meant that she would just still be alive, like inside and stuff. That like just to be able to give her that little life was nice and comforting.
So all absolutely normal. I'm very happy with that. Great.
Well, this is for Ellie, yeah. This one here. It's her little handprint and then a rose, a butterfly and her name.
I know you have the bag packed a million times over.
Yeah.
And I know there's a certain amount of anxiety when you've been through your experience with Ellie of, you know, going into that labour ward and hopefully coming through with a very positive experience in comparison to what you went through the last time. So we understand your anxiety. We will mind you throughout this process. It depends on how you feel about this, but is there something maybe that you have from Ellie that you'd like to bring into the labour ward? Is that, you know, sometimes...
I think we're going to actually bring Ellie with us.
I know, and I think that's lovely.
Yeah.
You know, you have to connect. She's the big sister.
Yeah, I don't think we could bring a blanket. It wouldn't be the same. We'd have to bring her. You can pop her over there.
Many years ago, whenever there was a loss in a pregnancy situation, perhaps as professionals, it was felt that the kindest thing to do was maybe to, you know, not dwell on the loss and sort of, you know, move on very quickly. In the last 20 years, I think we have learned from parents that their preference is that they want to acknowledge their baby so that their lives are moving on, but they're continuing to acknowledge that baby they lost.
I think we'll have her by tonight.
think we'll have her by tonight. I've good feelings. Just walked the same way we walked a minute ago. Yeah. They've just gave me hormones to try and bring on labour. So just have to go walk now. It doesn't really feel real yet that she's going to be here.
Yeah.
Like,
it's hard to even imagine.
Yeah.
Right, isn't it?
Yeah. But we'll have to start imagining her being here because she's going to be here forever. No, she's just kicking me.
Come here, Kayla, you're going to come to Cyprus then? I have the time off. Have you?
I need to save money.
You should go. Life's for fucking living.
I'm so in
I'm
debt
getting
this
tanned.
month. Like,
Arriving into the delivery suite with strong contractions is Kashini with her husband Tim. They are expecting their first baby today. Kashini has her own opinion on how to do things.
I didn't go for the antenatal classes and I didn't want any medication. I'm against medication.
She doesn't even take in Panadol.
Painkillers, I think that's big. It makes me tipsy.
Yeah.
it was very intense and, you know, horrific really, the pain that she was feeling. It would be quite rare for a first-time mom that you'd see such a quick progression. Like a contraction, if you can imagine, is all like your stomach muscles just squeezing in to kind of expel something, and that's kind of what a vomit is as well. She was really feeling sick and miserable through the contractions.
Oi, 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 oi. Relax. Breathe, breathe, baby.
I'm breathing!
I know.
You're doing great. It's all a big rush now. You're doing great. Where are you from, Kashini?
Mauritius.
Mauritius, lovely. How long have you been here for?
So we've been here since 2-3 years now.
2 or 3 years. You have an Irish baby?
Yes. Polish, Mauritian, Irish.
We met on Facebook. He sent me relationship requests. I find it really cute, so I accepted it. Because no boy ever dared to send me relationship requests online. I was like, I don't even know this guy. He's never been to Mauritius. I've never met him in person. Why? So it was just an online thing, yeah? I'm still safe. I know him from September 2014, and literally he booked flight for February 2015. That was our first time we meeting, first time, our first kiss was at the airport.
Yeah.
Yeah.
You're doing great now. You're going to have your baby in your arms really soon.
She was worrying how she will because her pussy was 2 centimeters, but now it seems that it got very fast.
I think it was just a kind of lost in translation that you might get a little bit confused with some of the names for things. So yeah, that was really funny actually. I was trying not to laugh.
Very good, baby. You see, the pussy is right. Okay, now everything goes well now.
10 minutes after arriving into the delivery room, Kashini is fully dilated and nearly ready to start pushing. Her labour has been extremely quick for a first baby, and Kashini is coping as best as she can without any pain relief.
I'm not crying. I'm just trying to make it through. I have small, openings, so I have to make it come out, make it through.
My back.
So
you sit forward with me, can you? That's it, come on, sit forward with me. Well done. Now we're going to get you to come back in the bed. So put your 2 hands behind you and lift back in the bed.
I have toilet, my poop is coming out.
It's okay.
That's your
My
baby.
poop is coming. I'm screaming, my poop is coming, my poop is coming, move out. That's how I was screaming, but it wasn't poop. The midwife nicely told me, oh, it's not poop, it's your baby.
Yeah.
You need to push more, you need to push more.
If you go and grab my hand, grab my hand. Grab your hand. Yes. Relax.
My leg's falling.
You're doing great.
Judging by her and how distressed she was in like a lot of pain.
Breathe.
When you're in that terrible pressure and you're feeling all of that, it feels overwhelming, like you feel like it's never going to end.
So the next time you get a contraction, I know you want to scream and you want to just let all that pain and that pressure out, but if you take a breath like this, and if you hold it, no, not like that, like this, and push into your bottom, like you're on the toilet doing a poo, you'll have your baby, okay? Because she's getting tired now, so we
You
need
have to keep it the inside.
Exactly, yeah. Can you do that? Do you think you can do that when it comes?
I was so excited that the baby's coming to me, to my hands, that I actually didn't even notice that she's in the pain.
Yeah, I was like, I felt like I'm losing you.
Yeah.
You're talking with a midwife, now I lose my husband. My life is destroyed, I'm dying. But he's flirting with a midwife. Now I had all that weird feeling of,
Oh, God.
you're cheating on me right now, all of you go off. It was all a mind thing.
Stop this, Dimek. I don't need you to rub my forehead. I'm tired.
He was trying his very best to be supportive, but I think at that stage she was just so far into her labour and so close to delivering that really there was nothing that anybody could do to kind of give her a little bit of comfort. She just had to do it and she just had to go with what she was feeling, but I think that was quite hard for him. I'm sure he found that hard.
Stop rubbing my forehead.
Okay.
Right now I'm trying to push a human out and you're doing this to me. I don't like it.
You're going to have your baby in your arms really soon, okay?
Carrie is having her labour induced, and she and Finton are hoping to meet their new baby soon. The delivery room is familiar to them, since less than a year ago, Carrie gave birth to her first baby, Ellie, who lived for just a few minutes.
Ellie, when she came out, like she tried to cry, and then it just went silent, so it was very silent in the room.
We knew it was what was going to happen.
Was it what you expected?
Yeah. I think the love she brought outweighs the pain.
Yeah.
Definitely.
The labour is quite a worry for me now. Because Ellie didn't cry when she came out and stuff, that I'm afraid this baby won't cry when she comes out. And just getting her out safely. She's a big baby. So I have a lot of work to do.
And again, big breath in. And again, go on, right down. Go on, right down. Right down. So you are pushing great. Contractions starting there now. So big deep breath in. Bring your legs right back to you. Like that, yeah.
After 7 hours of labour, Carrie is pushing hard, but things aren't progressing.
A bit more. That's it. And again, big breath in.
When it went past probably a half an hour of pushing, I kind of knew that it was a lot harder than last time, and I don't know if I actually was going to move her because I couldn't really feel progression as I was pushing.
Go on, right down. Right down, go on, keep going. Keep going, keep going, keep going, keep going. Right down, Carrie. That's it. I can't see her yet, but that's expected. Her head has to take 2 steps forward, 1 step back. You'll get there.
I don't care how she gets out when she gets out safe.
That's all that matters.
I could tell she was definitely running out of energy and it looked like you were going to give up nearly.
I can't do another one of them.
Oh, okay.
I really can't.
And I'll just see where the doctor is, all right?
I'm exhausted. When Martha said she was going to get the doctor, then I kind of thought, right, well, I obviously need help to get her out, or she won't be born. But I thought that I would definitely end up in in a section. When she said that she was going to do the suction delivery, I kind of thought it would be easier than it was.
Well done. Big deep breaths, Carrie. You're doing amazing. Big deep breaths now. Big breaths. Bring the legs right back. And go for it now. Go on, right down. Right down. Keep going, keep going, keep going, keep going. Really hard. Go on. Right down. You're doing brilliant. Keep going.
There goes from being like you, your partner, and a midwife to all these people, and that you know that your baby's going to have to be seen by a paediatrician when they're born as well, which is an added like fear.
And again, Carrie. Come on, big breath in.
It's a lot happening at the one time that you can't actually focus on what you're supposed to be doing, which is pushing.
The doctor came in and just seeing how exhausted Carrie was, and she said within 5 contractions she'll be out. And it was 3.
Pull up on those legs now. Pull up on those legs and push right down first. Go on, keep going. Good girl. Keep going. Keep going. Well done. Well done. Brilliant. Well done, Pat. Brilliant. Well done. 2050. 2050. Bring baby over. Well done.
Monster.
She is a big baby, the length of her. Let the centre to come, okay?
Oh.
Now.
Good girl. Come on now. Good girl. Now we want to be a louder cry than that. A louder cry. Well done.
As soon as I heard her cry, it was just complete like relief. Okay. Just happiness. Just like pure happiness.
Don't worry, I'm going
Just looking at her, knowing that she was going to be here forever, like, and she was ours, was just like probably the best. Well, it was the best feeling in the world.
love you.
You just did not want to come out, did you? No, you didn't. She's literally gotten to be her whole entire life. You were worth every minute of that. Yeah.
Yes, baby. Very good.
Just 30 minutes after arriving in the delivery room, it's time for Kashini and Tim to meet their first baby, with the help of midwife Ellie.
Sometimes because they just can't hear what you're saying or focus on what you're saying, so sometimes you actually have to say, like, look at me and just listen to what I'm saying to you. Especially like that when it happens very, very quickly. It's very hard to kind of comprehend and to take in.
Well done. Just breathe. You can. You can. Just breathe. Just breathe. Breathe. You're okay. Loads of pressure there now. That's her head. You're doing great. Just blow. Blow now, Kashini. Blow. Blow. That's it. Just let it come now. Just let it come. Just blow. Just blow. Blow. Let it come. Let it come. That's it. Well done. Now, Kashini, listen to me. The head is out. That's the worst bit, okay? Take your hand off me now. And open your eyes.
I was super happy. I was like the biggest thing I could possibly, like, she can't give me anything else, so I would be probably happy about.
I wish my whole family was here. My mom was here in Ireland, like with me that moment. It's not that I only want to share with my husband, but whole family.
Yes.
That all happened so quickly for you.
Born and 4th of February, no? Yes. Yes. Yes, my baby.
I always try and guess myself. If I'm feeling the woman's tummy beforehand, I'll kind of make a guess in my head.
I think she's about 2.8 kilograms maybe.
So that's just something I do. I don't know if other midwives do that.
Yeah, 2.88 kilograms.
I probably just got lucky that time and guessed it. I guessed it properly.
Hello, you're gorgeous. You're only a little doll. You're like a little doll. Yeah, you are. Yes. So I'll just give her this little injection and then I'll give her back to you and you can try and feed her.
Her name is Ridaya. Yeah, and it's H-R-I-D-A-Y-A. That's like, you know, a piece of your heart.
Look at her hat, she's so sweet.
Just want her to be happy.
Happiness, happy love.
Good boyfriend.
Yeah.
She had so many boyfriends.
Until 40. Oh, you okay? Yeah.
Welcome to the Rotunda, the longest running maternity hospital in the world and the busiest in Europe. It has seen the birth of almost 1 million Dubliners, and some 24 new babies are added to that number every day.
Well done.
Congratulations.
It's a place of extreme highs and devastating lows.
Please cry.
Agony and ecstasy, all happening second to second.
Lovely little fella.
We're there for the most intimate of moments as people experience events which will change their lives forever.
Yeah, the baby's almost out, come on.
Events to be remembered and retold for generations to come.
Well done, you're okay. Your baby's nearly here. Oh, here we go.
Partners are great, like you see the love like that they give to the women. Even the first kiss afterwards is lovely to see them, you know, it's like, oh, well done, honey, or, you know, you did it.
It's okay, Daddy and Mommy.
You can really see them falling in love all over again.
Sophie and Dara are arriving in the delivery suite, expecting their first child today. Their relationship started as a holiday romance when Sophie was just 16.
I was at my uncle's wedding in Tenerife about 4 years ago, and Daryl was on a lad's holiday, and it was my first time I was allowed to go out to the nightclubs and stuff, and then I met him then.
It was a love at first sight, yeah. She was, I don't know, she always just sort of caught my eye, and then there was always something about her, even when we weren't talking for a while, was we?
Yeah.
I just sort of always thought about you.
Oh, fuck. I had a miserable pregnancy. The whole thing was horrendous. Oh my God, my back.
Do you want to stand up? You might feel a bit better.
My mum always said, like, any pain relief they give, take it. And I was like, yes, I will take anything you give me. Anything. Yeah.
Okay.
So sore now.
I know. Holy God. Very squeamish, yes. Blood, needles and cuts and just little things
Sick.
like sick. Yeah, I'm very, very squeamish.
Yeah.
Maybe fist. Fist.
I was very worried that my legs were going to give way. I just had an image, and where we were talking about it beforehand, weren't we? It sort of, everyone was building it up, and I'm thinking, I'm going to pass out.
You don't like?
No.
Don't look then.
Yeah, like I've always wanted like kids. Like even when I was a little girl, like I would have always played with like dolls and stuff. Like it was kind of a thing to be a mum, but I didn't obviously expect it to happen this early.
It will need a vest or a newborn vest.
A newborn vest?
Yeah, so take them out, yeah.
Yeah. I didn't know what to expect because my sister's got a little girl, but that's probably the only little baby I'd been around. Is this one? And I hadn't changed nappies or anything like that. I'd just done the cuddles and then you pass them back then, don't you?
Gerald, I can't look, babe. Oh, I keep dropping the gas. You need to learn, Dara, what the stuff is.
And so I don't get to hold the baby until...
It depends. I don't know, baby. I might be allowed to like give the baby to you. It's like they'll tell you.
No, I don't want it with water blood and that on it.
Oh, okay. No, your dad doesn't want to hold you when you have blood and all on you.
No, I'll look at him when he's on your chest.
Look at her.
Him.
Her. It's gonna be a girl.
My family and all were like, no, you can't find out. Like, it's the best thing not to know if it's a boy or a girl. And we were like, right, okay, we won't find out. But then it was my 20-week checkup, so I knew like it would be kind of like a detailed scan. She's like, right, do you want to find out? And we were like, yeah, go on, like tell us. Yeah, no, the baby like won't move its legs. Its legs are like locked against, so I actually can't tell you what you're having. So we kind of knew that was like a sign that we weren't meant to know.
Today is my husband's birthday. I bought him a birthday card at least a week ago, and actually it was an expensive one. You know where you pick up a Nice card, one, like, yeah. You get to the flip and check and you realise it's a card that's going to be in the bill after 2 days. I know, it'd be right. Thank you. Yeah.
Today's my birthday.
Is it? Oh, happy birthday. You want to share a birthday with the man of my dreams?
On their way to theatre are Ciara and PJ, who are expecting their second child. Their baby is in a breech position and they have opted for a Caesarean delivery. When the couple first met online, they seemed to make a good match.
Like it was nearly like a social network more than just a dating website. So you could make up like quizzes and questionnaires, and there was a quiz, how punk are you? And I got 69 out of it. I thought that was really funny. On a dating site, the innuendo. So there was a little option of email the creator and sent a really embarrassing, corny email. And that was the start of things 13 years ago.
Yeah. I was only actually looking for like a short-term relationship at the time. I was kind of like, right, I'm gonna see what this whole thing is like, and I'm like, yeah, you know, have a girlfriend for a couple of months and then another girlfriend and see what happens. And yeah, it's first
3 years married
first
now.
attempt, yeah.
Ciara and PJ had problems conceiving with their first child, so they decided to start costly fertility treatment.
We had said that we would spend a certain amount of money on a honeymoon and we would go to Las Vegas. And I asked him, what would you think if we axed Vegas and we just did this as soon as possible? And he just said yes straight away. That was it.
Fortunately, Ciara got pregnant with their first child, Fia.
We couldn't believe it was only twice. You know, we know other couples who've gone through much, much longer journeys.
After the birth of Fia, Ciara developed postnatal depression. She then became pregnant, this time naturally, when Fia was only 9 months old.
It was a real mixed bag of, oh my God, this is amazing, we conceived naturally, to, oh my God, how are we going to do this? It's so soon after Fia to be going through all of that again. But sure, look, it'll all come flooding back to us. We were still slap bang in the middle of postnatal depression, and here we were pregnant again.
Yeah.
This is an antacid drink, so you have to drink the whole bottle. Okay, kind of taste it, kind of liquoricy.
Well, postnatal depression is a depressive illness that affects about 10 to 15% of women after having a baby. It usually starts within a few weeks, maybe within the first 6 weeks following delivery. Although in about a third of cases, it actually starts earlier in the pregnancy. So it can actually start before the baby is born.
The anxiety was just kind of taking on flight of its own. Like, thoughts that were coming into my head were starting at, oh, what if the person driving her hasn't strapped her into the car seat properly, which would spiral into, oh, well, they're definitely going to crash. I can nearly see them crashing in my head. And I wouldn't be able to verbalise any of this to PJ. I'd just be getting more and more wound up and upset, and all I could do was cry or snap at you.
The characteristic symptom is a depressed mood. It's a woman feels down, feels low, feels very unhappy. She may be tearful. She may say she cries for no reason at all. So postnatal depression frequently will put a great strain on a relationship. And that can actually lead to relationship breakdown.
There was days I could get up and kind of wondering what was going to happen, how were things going to pan out, because the anxieties and issues, you just didn't know what could trigger them.
I had come to the conclusion that I shouldn't be in Fia's life for her own sake, and that was the scariest point, was to have those thoughts and those feelings and to be so sure. You know, it's really hard to explain how sure I was that actually this is the direction that things needed to go.
Ciara started regular counselling sessions to deal with her depression.
I had about 20 sessions with a psychologist, and I think even from the first and second session, things just all started to make more sense. I'm the kind of person that if I can understand why things are happening or where these thoughts are kind of starting from and rationalise them, that things will make sense for me and things will start to click. I think if you can understand your thoughts, you can change your behaviour, and things just started to really, really slowly but surely improve for us.
She's been through a lot the last 2 years roughly, and just, you saw she's still here. She's incredibly, you know, keeping her head up, going in for this. So she's incredibly strong, whether she knows it or not. You know, she is.
Midwife Veronica is checking how far dilated Sophie is.
So what do you think?
As with most first-time mums, she expects progress to be slow.
Before I went up to the labour ward, I was 3 centimetres, and then I came back in and she checked me a few hours later. She's like, "You're still 3." I was like, oh no, it's going to be one of these where it stays the same, goes up 1. And then she came back 2 hours later and she's like, "Do you want to guess what you are?"
Tell me a number.
6.
5.
Well, I'm going to say 9.
9.
You're joking.
No.
Yes.
No.
9.
We are expecting 1 centimetre per hour. In Sophie's case, when I examined her first, she was 3 centimetres dilated, and after 2 hours, she was 9. That's a huge progress.
Okay.
Yeah.
You're a bit in shock, aren't you?
Yeah. I thought you were laughing. I was just there
Yeah, I put my face like.
Yeah, I was just there like 9. She was like, she's lying. I was like, I'm
Looking
5.
Looking disappointed, but no, I was joking. Yeah.
We want a poppy for a girl, and I think she's
saying puppy.
Puppy, and she was like, puppy.
How would you call a baby dog? Puppy?
A
puppy.
Puppy.
Puppy. And this is?
So puppy is a dog, and then poppy.
Puppy.
Poppy.
Oh, nowadays everybody put like weird names to their babies.
Poppy is the baby's name, and puppy is the little dog.
And how do you spell the baby's name?
Poppy, and puppy is Puppy.
And for me, it sounds the same. I don't really get the difference.
This here.
So, Daddy.
Daddy.
Sorry.
I have a work for you.
Right.
Wherever the lips comes, there's an alarm. I will let you know when it's alarming. Yes, I need you to press this button.
Right.
Because I will be in the other side.
Right.
Okay.
Yep. A friend of mine, he had his girlfriend had his daughter, was it about 4 weeks before? But it wasn't the best birth. They had to sort of get the emergency team in, and so I had that in my head.
You can sit down. You know, once you hear a beat, though, go.
Yeah, you are going to stay with us. Yeah.
And I didn't want to tell Sophie because I wasn't going to scare her. And she said, "Oh, did Tom's little girl come out fine?" And I'm saying, "Yeah, it was fine." And I'm thinking, "Oh God, I don't know what's going."
Why are you panicking?
I don't know.
You don't have to push.
I was giving it sort of the macho, be fine, and then when it gets to like, you're thinking, oh,
he's like,
Jesus, I don't know.
Yeah.
Why you laugh?
You're just funny. Typical man, like. You wouldn't be able to do this. That's why we do it.
I'm metabolic. I'm 48 in June and I came up as 48.
Oh, okay.
Yeah.
Okay.
My visceral fat, is it your visceral thing?
Yeah.
That was normal.
Oh, that's good.
Yeah, that was...
Why did it tell you that you were in your obese?
It didn't tell her she was obese. She's lying.
No, I'm not, I swear to God. On the graph with your height and your weight, I'm heading out of the end of the normal zone into the...
Yeah, but the normal, like, everyone is top end of normal.
Well, she told me I need to get back in the middle to have a bit of leeway. She told me to come back to her in 3 months. I'm sitting, and I was only in for my little 5K and I thought I'd be lighter because I felt I was having a thin morning. Anyway, I wasn't having a thin morning.
Ciara and PJ have had a new baby boy, who they have called Cuan.
We heard his little cry, and I remember him being brought over to me, to my side of the curtain, and just touching his little face. And I just thought, oh, that's just all been worth it now. So then there was the whole palaver stitching me back up, and actually they had said to PJ, "Oh, Dad, do you want to come over and meet your son?" And PJ wouldn't go. Sorry, I'm actually getting kind of choked up remembering that part. PJ wouldn't go. He said, "No, I want to stay with my wife until she's okay."
This is what all the fuss is about. She needed me more there. This was not a good labour, and everything that we've gone through, like, I just couldn't walk away.
It's definitely had an impact. You can't deny that it's had an impact on our marriage. Certainly, we've both come to the conclusion that we would like to go for just some couples counselling, not because we're on the edges of splitting up, far from it, but just it was a lot to go through together and 2 different experiences of the whole thing. I have a wraparound service between the Rotunda's mental health team and my own mental health team, just to check in and make sure that there's no relapse, no new issues, just keeping myself well, basically.
Just can't get complacent about things. As much and all as she supports and everything is in place and we have people, just still there will be that part of me that's a little bit over vigilant, just watching and just making sure everything is kind of ticking along. Thanks, guys. Ready?
When I first started as an orderly, we had tables in the wards. It was a great thing because the girls used to go to their spot. There'd be only so many boiled eggs on the table. They used to dive for their boiled egg and their cereal and their bit of toast and their tea. But that's when they all had the chats. And then as soon as the babies start crying, they gradually go back to each bed. It was good fun in those days with the tables.
It's 6:55 a.m. And after 7 hours in the delivery suite, it's time for Sophie to start pushing.
Let me pull it, but you just hold the weight.
Right, yeah. I won't be able to look down there.
Don't look down there.
I'm looking over there. My legs will go.
Your legs will go?
No, they won't really, but I just won't be able.
Just don't look.
No, I'm looking at that.
Before I even started pushing, like, she was telling me that now you could be like 45 minutes, you know, it's the average of women, especially their first baby, to be pushing for ages. And I was just like, I actually do not have the energy to push that hard for so long.
It's a huge push, that's the one. Come on, honey, keep going, keep going, keep going, keep going. A little bit more. That's it, and again.
3 nose.
Elbows out.
Go.
Sophie, elbows out, honey. That's
Come on,
it.
Soph.
That's it, keep going, a little bit more. You are moving, baby, now. Come on, honey, keep going, keep going. Okay, breathe, and again.
Nose.
I knew when she was like, push, like I was giving it my all, like 100%.
Okay, focus on the pushes, okay, honey?
Go for it, Soph.
Okay, so take a deep breath into the nose and huge push down.
Come on,
That's
Soph.
the one. Come on, honey, keep going.
Come on, Soph.
A little bit more,
Keep
more,
pushing,
more,
keep
more,
pushing.
more. That's it, huge push down. Okay, and now relax.
Oh yeah, I press the button. What was it, when it was beeping?
Yeah, when it started beeping, you had to press
Yeah.
it to stop.
Do you mind?
She said, you gonna press that? And oh yeah. Yeah, it was only one job and I didn't even do that right at one point, did I?
Amazing push, I promise. You know, the head is almost to be crowning. Crowning means that the baby's never going to come back.
Okay.
And after this push, the baby's much better. Okay?
Okay.
In the Rotunda's pillar room, performing for a fundraising event for the hospital, is expectant first-time mum and professional opera singer Yana and her husband Emmanuel.
Actually, we met in church in Romania. And we were in a choir, in a youth choir. So everything resumes to music, you know.
Yana is like a dream come true for me, to be honest. Since I met her the first time, we were like kids. And I knew that that girl is special, has something special in her. I don't know what. I'm in love with her voice. But like Yana is very friendly, and she's a very good person.
He's very sociable and very friendly, and I really like that. And he smiles and makes jokes, and he also sings nice.
Yana had been complaining of feeling ill, but Emmanuel had a hunch that something was up.
No, it was like a strange feeling for me, you know. Let's do a pregnancy test, you know. Let's try it. I don't know, maybe it's not, maybe it's 1% chances, you know, to have it.
It was a nice surprise, actually, which I didn't kind of expect. I thought I had like a bug or something, a stomach bug, because I was vomiting and I didn't know I was pregnant.
Baby will be doing a lot of headbutting, and that's great because that's going to get the colostrum down. It's going to stimulate the hormones. But the baby...
At a Rotunda breastfeeding class, Yana is studying up on the brand new world of breastfeeding your baby.
If you're sectioned, midwife is going to give you the baby this way so they can keep working on you here while you're doing your skin to skin. So it's no different. Yana was concerned because she was having a section that maybe the baby wouldn't latch within the first hour of birth. So I did explain to her she could hand express if the baby doesn't latch immediately after birth. This is what I love about this group, because we'd have a mixture from mums to be from other countries, and we actually learn from each other. Our breastfeeding rates are quite high in the Rotunda. They're increasing every year. Just like in Ireland, our breastfeeding rates are increasing. Your right hand and placed on baby's shoulders, excellent. And take your other hand away. So bring your right hand right up to the shoulders, thumb under one ear. It's easier for me if a smaller baby, fingers under the other.
no headache, nausea and vomiting.
Yana wanted to have a natural delivery, but since childhood she has suffered from a condition which makes a caesarean section the safer delivery option.
So do you know what you're having, a boy or girl?
A boy.
Oh, lovely.
Philip, we think.
Oh,
to
that's
name
lovely.
him.
So you're on the countdown now, which is fantastic.
The risk for Yana, if she was to go into labour, would be that the baby's head would come down onto her pelvic floor and put pressure on her bottom. And particularly during the stage of labour where she would begin pushing, we tell women frequently, push into your bottom. The danger would be that Yana would push out the rectal mucosa.
I was looking through your notes, and I know you'd met Dr. Rishi, and we'd had that kind of clear conversation around how we felt that it would be much better for you to keep the pressure off the back, particularly your bowel with the pushing. So the hope is at 39 weeks that we're going to give you a date to work towards, because otherwise it's a very long 9 months. And we'll bring you in fasting at around 39 weeks for caesarean.
Okay.
Have we given you a date yet?
Yeah, 8th of May.
Oh, fantastic. Hello, there he is.
Oh.
And you can see there's his hand up in front of his face.
Back in room 8, Sophie is still pushing and getting very close to delivery. Daryl is keeping safe at the head of the bed.
Going a little bit more. Come on, honey, you are very close to finish. Okay. Blow.
Honestly, couldn't look down
Oh,
there.
you're not looking?
No, I was looking towards the
Oh,
wall.
I actually thought you were looking.
No, I couldn't look once.
Oh my goodness, you're absolutely amazing, honey.
When her head come out, that was when I saw, like, oh my God. Like, not horribly, but it was sort of just like, that's coming out of there, like, jeez. Like.
Absolutely amazing, honey.
Oh, Jesus.
Head is out. Okay. Once the head is delivered, then we wait for the restitution, which is like an internal rotation of the shoulders and external rotation of the head. So the baby needs to do that, and that's very important to know, to make sure it's happening, to prevent a possible shoulder dystocia. Okay, I'm feeling one, so just give me a huge push down, okay? That's it. The way Sophie was pushing was absolutely amazing for being the first baby. And because she pushed the way she did, the baby came out very fast. That's it, a little bit more. Okay. Open your eyes. Oh, 7:15. Oh. What do we have?
I don't know. Look.
Puppy. Oh.
Oh, I definitely started crying
Yeah, when she
come out.
came out, and I was just like, oh my God.
It's just like a real overwhelming
feeling. You're just
yeah.
like, oh my God, like she's yours.
It was just a life-changing moment, wasn't
Yeah.
Congratulations, honey. Absolutely amazing.
I think the bond between both of us just automatically sort of went stronger.
Just clicks,
just sort of.
You just realise that like these are your family, and it's just like she's your little girl.
Yeah,
Do you know?
you got
and you just have to give her the world. Like as soon as you see them, you're just like, right, I'm going to do everything for you, and give you the best of everything. And that's definitely the way I felt, anyway.
Yeah, no, I totally agree with you.
I'm so proud of you, Soph.
So, Papi. I was like, oh my gosh. Happy birthday, Papi.
They'd be looking for me in the emergency room on a Friday to see what have I baked today, and so I can get things done in the hospital by telling them I'll bake you a cake. If something needs to be done in maintenance or in any department of the hospital, I'll tell them, oh, I'll make you a cake if you do that for me.
In the emergency department, being monitored are Slovakian Daniela and her Malawian husband Fred, who are expecting their first child together. Daniela had some set boundaries before she met Fred.
Here we are, getting close.
I met Daniela at work.
He was my colleague, and I don't mix the business with love.
We was the same level because I'm kind of nursing way and caring.
She felt like she knew more than I knew,
Anybody
so she
else,
can tell
yeah.
me how work is done. See,
And we have to keep them like the same way like at home. Like when you take the clean plate, you put the clean plate back. So
leave him alone. He has a GPS on. Don't worry, he knows navigation.
He's sleeping. We had a date and we started going out. I think it's after 2 or 3 years, no, 3-4 years that then I proposed to her and then we get married.
Lovely, thanks Emil, bye.
When Daniela came in, the waters had broken and we noticed that there was meconium in the waters. So because she wasn't in established labour yet, the obstetrician came to see her and they made the decision that they would induce her.
The only reason we're inducing is because of the meconium. Otherwise we would wait 24 hours, but we can't wait when the baby's floating around in the meconium, yeah.
from my nursing knowledge, I know what's going through because even the first daughter have had the same, but water didn't broke, so it was the other way around. I was a little bit like scared, like if the baby will be like right, like everything will be okay with him. That's all.
What kind of nurse were you, or are you? General. General nurse, lovely. You're busy.
By the time I went in, she had just started on the oxytocin drip, and she had a few cramps, but wasn't really in labour.
Now, Daniela has never had an epidural, okay, so she's got a good pain threshold.
Yeah. Typically, Eastern European women are very stoic. Their epidural rates are much lower than Irish women's epidural rates. So if you're meeting an Eastern European woman who's had 2 big babies with no pain relief previously, you kind of know they're well able to have this baby.
Dad, Freddie, has gone downstairs to grab a few bits and pieces. He's going to get a ball. We're going to get mobilising.
Sounds like a plan.
Try and shake this baby out.
Fred has been in the delivery room before, on his first marriage, with alarming results.
With my first child, I passed out. I was really looking forward to it, but the experience of seeing a child coming into the world caught me off guard.
Hello.
Hello.
I'm Ellie. I'm going to look after you.
All right, thank you. This time around, I say, you know what? I'm gonna make it through.
Do you want to come up a little bit? You're sliding down. Are you okay?
Jesus, that's a strong woman.
Yeah. Now, pull yourself back there.
When you're trying to get a labour to move on and you're trying to get the baby to come down and move into the pelvis, the best positions are upright positions because gravity is going to help the baby come down. So walking or sitting on the ball just allows you to be upright, and the ball is really good because it means the woman doesn't have to support her own weight. You know, she's sitting down, but her pelvis is in a good position to allow the baby to come down.
See, we have the woody floor, so it's kind of...
Yeah. Have you been sitting on the ball? At home?
Did tonight, yeah. This last night. Not tonight, last night. And our doggy doesn't like it.
The ball, no?
No.
She barking for the...
She's scared.
Yeah.
When we brought up the ball first time at home, Ruby hates it. She was going and barking, fighting with the ball because she didn't expect to be having it in the house. And I said, look, this is your new friend.
When I was getting pregnant, I didn't know it. That dog come to me and start like sitting on my lap.
Before, she never come and very clearly cuddle with me. But that day when I did the test, she was the first one who came and jumped on my lap and she stays without calling her.
And me and Fred, we look at each other like, what's going on? Then bingo.
She knows.
Then later on, actually, I read somewhere the article, like dogs from your output, like he feels like your status is changed and you're pregnant.
He never before come and sit next to me. These days, he's sitting here, sleeping on my foot. Like...
Well, hopefully it likes the baby.
Yeah.
I was in the swimming pool one time. I did lane swimming for a while, and there was a fella in the lane beside me. We got up to the top, and next thing he goes,
And where?
And I just, at the swimming pool, and the coach, I just said, tell him to stop it. Please tell him to stop it.
That's disgusting.
A big gullier into the pool. Oh. And all I kept thinking when I was doing the swim was, disgusting. And it turns, like even walking along the road, if I hear someone doing it, that is disgusting.
Daniela is feeling unwieldy with her big bump. She has had 2 big babies before from a previous relationship when she was in her early 20s.
The bump looks bigger when you're sitting up, actually.
Yeah. But this is the half size.
Really?
I'm
Before
telling
the
you.
water broke?
Yeah. It was bigger.
I came to Ireland 2007, planning for 3 months. And here I am, 12 years, second time married with Fred. Blessed with a 3rd child. I have 2 children from previous marriage.
So there's a lot of brothers and sisters now to look after it, this baby, doesn't it?
Yeah. But I think so, the oldest sister, actually I spoke with her yesterday, I told her like, if I go more than 10 days overdue, I'm gonna blame it you. And she was like, why? And I said, because you are firstborn.
Yeah.
And this morning, you're going to show her that, hey, the baby is here after that conversation.
So I'm gonna pray for you, I will. So, okay.
No, we never actually discussed about having a baby. I felt like past, because she's 17 and Sophia is like 15, so such a thing never occurred.
Oop. What fell?
The baby.
I'll be feeling, don't worry. That 4 kilos, I'm gonna definitely feel it.
Generally, women who have had babies before labour much more quickly and much more effectively than somebody having their first baby. But if there's a long gap, and especially if somebody's had their first babies young, you know, kind of 17, 18, and now they're in their late 30s, it can be more difficult for them to labour. But I think it's age as well, you know. When you're young, labour is much more effective. So if you roll round on your back then, Daniela, and we'll see what's happening.
Fix your pillow.
I have the very small knickers. Freddie, do me a favour, go in this cupboard, the top one. Open the doors right up and I'll show you. Now, see the thing that says Amni hook in the middle? This one, yeah, give me one of this one. I think there's still a little bubble of water in front of the baby's head, so I'm going to pop that one. Sorry. Oh. Yeah, finished. I think you have a little while to go. So it's up to you. You want to try the gas and see if you like it? And if it helps, we'll keep going with that. And if it doesn't, then we can give you either the pethidine injection or the epidural.
Okay.
What do you think? Can we try it and see? Because you are coping very well.
You look like Aggie there as a Kim. Which one? Who's the blonde one? She's Kim. She does, doesn't she?
Yeah.
She.
The face you made.
You make those faces.
It was the face.
She's like that. Yeah, that's what we mean.
How are you feeling? Good, yeah, I'm so excited.
The moment has come for Yana and Emmanuel to head to theatre for the delivery of their first child, and the excitement is palpable.
Finally. So he will be the first boy in the family, and everyone is just delighted. Oh yay! There will be a boy finally.
I need to drink all of it, yeah?
Oh, look at this.
I think so.
Look at that. Hello, you. That's a nice one.
Oh, yeah, just welcome in the world.
Exactly.
Okay, that's great. Thank you. You might feel a little bit of a stretch there. That's great. Now, drop the drapes a little bit. The moment I can see. Oh my God, crying before we're even out.
I can see him.
Hello. Hello. Hi. Oh, his face a little clean there.
Yes. Yeah, it's a boy. Look at that. Oh. so cute. Oh, well done. Yes.
Good settle down, he's like his mum. Is he going to be a singer as well?
Well done.
Oh, you're gorgeous.
Oh, look at.
Thank you very much. Congratulations, he's fab.
Thank you. Oh, look at you. Oh, thank you very much. Look at that.
Like.
Yeah, Philip. Hello, boy. Oh, well done. Well done. You're very good. Any pain? No?
No.
Do you feel anything?
Shaking a little bit.
Yeah, it's quite normal. It's a bit cold as well, but you'll be fine. Yeah.
3.35 kilos.
Oh, lovely size. Very good.
Oh, look at you. Look at that. Yes. Oh, sorry. Yes, look at him.
Look at these little fingers.
Oh, look at that. Look at that. Yes. Laughing it. That's the most amazing thing in the world, to be honest. Daddy. Yes. Bon appetit. Bon appetit. Congratulations.
Thank you, me too.
Thank you very much. I have a boy. Oh, wow, that's so nice, so cute. I know. Daddy's here. Yes. Daddy's here. Yes.
One day I was going up to the NOCU and there was a guy at the door trying to get in. He stopped me, he said, can I come in? I said, is your child in there? And I was going to swipe him in. He said, no, we just want to have a look. I said, what do you mean you just want to have a look? He said, at them. At him. I said, the babies, all the small babies. I said, it's not a zoo. You can't just go in and have a look at the kids. Like, he goes, can you not?
This was the wrong time to bring these out, like before lunch.
I know. But what can you do?
And what can you do? Eat them.
Yeah.
Oh, I'm spinning work. What a waste. What a waste.
New mum Sophie's attendance at the Rotunda didn't end the day she left with her baby, Poppy. She now accesses their mental health services after a difficult struggle with postnatal depression.
Yeah, so like in the hospital when I couldn't get her to latch or she wasn't feeding or anything, like there was always a midwife or a healthcare assistant there to help me to come in no matter what time of the day or night it was.
When that's the case.
We didn't have to do anything, all we had to do was literally sit in the bed and feed the baby, like nothing. And then you're just kind of, papers are signed and off you go and it's just like, no, do it by yourself. Like, Poppy was probably 3.5 weeks and I was still crying, like couldn't cope, like didn't want to be around anyone, didn't want to be around her, like, and especially with being breastfed, she had to be around me, like she was constantly attached to me and everyone says it's a magical feeling and a bond when you breastfeed and it wasn't like that for me at all.
Yeah.
And I don't mind, like I don't be like, oh my God, like I have to get up with her in the middle of the night or oh my God, I have to have her tomorrow. It's not like that anymore.
Yeah.
So I stopped the breastfeeding and it was just one day here, I just like to my mum, I've had enough, like I just don't want to be here. Like I start getting really like distressing thoughts of like suicide, a lot of stuff. So it was an horrendous time for me and I knew that this wasn't normal because if every woman felt like this after having a baby, you wouldn't have babies, like you wouldn't have any more kids. Definitely have like much better days when I'm starting to kind of like enjoy things. Like
I couldn't understand why she wasn't happy. Do you know what I mean? Like I never understood like any sort of depression, let alone postnatal depression. And I'm sort of coming home and she's sort of not enjoying it as much as I am.
And that not enjoying things, you know, it's a real core symptom of depression, and so to see that lift is really encouraging.
Yeah.
Society's representation of pregnancy, motherhood, is completely at odds with the lived experience.
With my generation, like my age group, all I did was look at Facebook and Instagram, and it was these mums that had babies same times as me, and their figure was perfect, and they were.
A pregnancy can be very challenging for a woman. She may feel that she has to live up to certain expectations, that she cannot complain, that she cannot say, I don't feel great.
And she's perfect, I'm not, so.
Incredibly
unrealistic
expectations.
Yeah, it's amazing, I look this great, and I was just like that, like, why can't that be me?
I'm sure we spoke about mindfulness at some
Oh
stage.
yeah,
did we?
I love mindfulness.
And you're doing bits and pieces of it?
It takes a while to get into it, and at the start you're like, oh my God, it's so stupid, but then when you actually relax and just do it, it will work.
Sophie spent 3 weeks in another hospital as an inpatient, receiving treatment for her depression.
At the moment, I've come out of hospital, but I'm still attending their day programme, which is amazing just for, you know, the support and the kind of tips and skills to kind of deal when I'm feeling overwhelmed or any anxiety or stuff.
You have our contact number, so if there was a problem, you can contact us and just we could see you sooner.
People need to be aware that this can happen and it's okay to happen, because there is so much support when you actually like are involved in it. Like, you see a completely different side to the services and the support networks there, and even being out, the amount of women that I've talked to who have been, I had postnatal depression, but yeah, they were too ashamed to say it. And that's why a big thing to me, and I think even to my family and stuff, like, I want women to know it's okay not to be okay.
Look, it's been great.
Thank you.
It's gone so well.
That we have each other, do you know? And it's okay, and you'll get through it.
I like having a day where I will blitz my house from top to bottom, and I love the smell of bleach in the bathroom and the kitchen.
Come here, I flip it.
It's not good for the environment. Well, it's good for getting rid of all the
I like
bugs.
that flower. Is that what you call it?
What?
Flower.
Zoflora.
Zoflora. That's lovely. And I think it's really good for the floors.
And then all the floors are mopped. It's lovely.
Back in room 8, Daniela is close to meeting her new baby. She's been using the gas to deal with the intensity of the contractions.
Excellent, that's it. Well done.
When I asked her how long and I have to going through, and she said like 6 more minutes. Be honest with you, that 6 minutes was for me was like a hell. I'm not gonna make it.
Okay, give a little push then if it's there, Daniela. That's it, well done. Perfect, and a little one again. Well done, now just blow like this. Just blow, 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 blow. Just blow, perfect. Well done. Now, that's the worst bit, okay? That's your baby's head. If they're labouring with no analgesia, you get a feel for them, you know, they go into their self and there wouldn't really be vocal communication anymore, you know, it would be more reading her body language. So the baby's coming actually, give a little push down. No! Look at that, 6:22. Oh, look at that, well done. Well done, Daniela.
I can't prescribe, but there was as well like love for the first view. Like when you touch it and you see it, like he's fine and he's here.
Mommy was hours.
Well done. You were very good.
He was perfect support, and midwifery, she was absolutely as well perfect.
Yeah, let me see this one.
He's gorgeous.
Well done.
I know.
Like very excited when I saw him, and from the first time my eyes caught him, I felt like it was a healthy baby, so I thank God for that.
Oh my God, we can hear you. Yeah. Well done.
Oh my God, you're fantastic.
You were fantastic.
No, you are the fantastic.
Welcome to the world, son.
No, it never gets old. Like, I think that's the best bit about it. You know, you're kind of privileged to be there in that moment and be part of it. And it's lovely. It's a lovely moment. You are a big boy. Was he 4.5 kilos? About 10 pounds? I think it's about 10 pounds, yeah, he's a big boy. 4.54. 4.54.
Jesus
Very big.
That's a big boy.
That's a big boy.
And the 56 is not gonna fit him.
The clothes?
Yeah.
I was ready. Even I didn't buy the clothes from 0 to 3. I always buy it from 3 to 6.
You feel okay?
I feel very happy.
package.
Mission accomplished.
Yes.
Welcome to the Rotunda, the longest running maternity hospital in the world and the busiest in Europe. It has seen the birth of almost 1 million Dubliners, and some 24 new babies are added to that number every day.
Well done.
Congratulations.
It's a place of extreme highs and devastating lows.
Please cry.
Agony and ecstasy, all happening second to second.
Lovely little fella.
We're there for the most intimate of moments as people experience events which will change their lives forever.
Yeah, the baby's almost out. Come on.
Events to be remembered and retold for generations to come.
Well done. You're okay. Your baby's nearly here. Oh, here we go.
I have never won the Star Midwife trophy.
This belongs to me and Susanna.
Yeah, it rotates, obviously.
Between the two of them only. No other member of
Midwife
staff.
of the Century and then Star Midwife.
No other member of staff have ever received the trophy. They just passed it amongst themselves. Inappropriately.
Jealousy is a desperate thing in outpatients.
Walking the Rotunda's corridors, trying to get labour started, are Dubliner Sarah and her husband, Kilkenny native Dara, who are expecting their first child.
We met December 2015 on Swiping Right, Tinder. Didn't know he was a culty when I swiped right. That was, he hadn't got that, so don't know whether. I'd never given a countryman a chance before.
I'd never given a double chance either, so we're both ways. Sarah's a very happy-go-lucky person. She's very, very positive. I think she rubs off on people in a nice way. I think she has nice energy.
He was the fella that my mum always wanted me to bring home.
Don't put that in.
He balances me out. I suppose I'd be very more live wire kind of out there, so we're a good yin-yang for that. No, he was definitely the man that my mum wanted me to bring home. After many frogs.
It's a relief to be in the delivery suite after a fitful night in the annex, waiting for labour to begin.
First-time parents didn't realise how long the process could be, so obviously hear stories, some people are very quick, some people are, obviously like us, not as quick, so we didn't have visions of maybe being there that long.
Sarah and Dara have found out they are having a girl.
And is she going to be the first of many grandchildren, or?
She's fourth on my side, third on theirs.
Third on my side, yeah.
Third, oh God, that is so exciting, isn't it?
Yeah, so
Everyone's waiting on the phone, I think.
Absolutely, I'd say the phone's been ringing off the hook. And do they know that it's a girl?
Yeah. I can't keep secrets.
No. And did you have any plans for delivery or anything? Had you read anything you were like, oh, I'd love to do that?
No, just listen to the professionals.
Like cut the cord or anything? Would anyone like to cut the cord?
Cut the cord?
Yeah. Lovely.
Let's do that, right?
Our bare plan, I suppose, was just listen to the professionals, trust them, take their advice, go with what they were saying.
Take all the pain relief that's been offered.
Yeah.
She's never been asked before in her life, I'm afraid.
Really? Last night was my first night staying over. Was it? Well, that's good. Healthy.
Yeah.
Healthy. No need for a hospital.
Exactly.
Last time you were here, it was probably you as the baby, wasn't it?
Yeah. I was born here.
Were you born here?
I was.
Oh, fantastic.
And I was an attraction, apparently, because my mum was only about 4 foot.
Oh, really?
And I was 10'8", and I was a week early. People were coming from everywhere to see the big baby that came out of a small woman.
Out of a small
My mum is tiny, in height and frame and all, so I was like, oh God, if she had a 10-pound baby, I'm tall, and what way is it going to work? So that was a bit of a concern.
Can you generally tell how big a baby is by looking at someone?
Give a good guess, yeah.
What would you think that
I'd
baby's
say
going to weigh?
it's a good 8 pounds.
Yeah?
Yeah. 8.5.
It's like the snapper, what was that? Was that turkey? Was it 9 pounds? Is that a baby or a turkey?
Is that a baby or a turkey?
I hate feet.
I'm dying to get my toenails done. I feel like it's the only way I can treat myself in here. So I just get your nails done.
I know.
I'm dying to get my lashes done as well.
Where did you get your lashes done?
On Dorset Street. Yours don't look particularly fake, though.
Do you think?
No.
I'm 3 years getting them every month. I'm fully Every addicted. month? Every month. What? I've given her probably 10 grand.
This is the umbilical cord here as it goes into the placenta. So this is the baby's head up here.
In fetal assessment, Ellie, a patient from Dublin's Coombe Hospital, has been referred to Professor Malone. Ellie is 31 weeks pregnant, but her baby has been diagnosed with Rhesus disease, a condition where antibodies in her blood are destroying her baby's blood cells.
And this is what we call the middle cerebral artery.
Ellie has 4 other children, the last of whom was also affected with Rhesus disease.
I wanted to have another baby. I knew it would have to be a pregnancy that was monitored a bit more closely. But I probably didn't realise quite how, as the pregnancy went on, it was worrying, wasn't it, towards the end?
And the flow of blood in the middle cerebral artery suggests that the blood is flowing very fast, which is consistent with significant anemia.
Okay.
So I think these Rhesus antibodies are crossing the placenta, are attacking the baby's blood, destroying the baby's blood and making the baby anemic.
The antibodies can cross the placenta and attach themselves to the baby's red blood cells. And that causes those baby's red blood cells to burst, or hemolyze as we call it. And that can lead to profound fetal anemia in that baby, which can be fatal if not treated and not detected early.
Just looking to see if there's any evidence that there's heart failure.
Well, about 50 years ago, this condition was quite common because we didn't have any prevention for Rhesus disease. But with the advent of anti-D, the prevalence of the disease has decreased significantly. And so we would see a woman with Ellie's level of problem maybe only once or twice a year.
Whilst Ellie has had anti-D treatment, this has been unsuccessful. So the next stage is a blood transfusion for her baby.
In Ellie's case, her ultrasound findings were already showing evidence of severe anemia, so we arranged for the fetal blood transfusion to be done within 24 hours of her first meeting us. We'll give the baby sufficient blood to take the baby out of the danger zone, and that should ensure that your baby will be safe for the next 2 to 3 weeks.
And it must be a fine balance, when you're talking about the heart failure.
Yeah.
It's a fine balance for you to decide whether to do this or deliver.
I'm very confident looking at how the umbilical cord is set up and the anatomy here that technically we should be able to get a needle into the baby's umbilical cord.
Yeah.
And technically, I think we should be able to accomplish a transfusion fairly easily. Obviously at 30 to 31 weeks, the baby can survive outside the womb. So if we saw the baby get into trouble, we absolutely would go for the to help the baby out.
No, that's brilliant. Thanks very much.
Okay, let me give you a hand up.
Thank you.
We'll go from there.
It's undescribable as a father to look down and, you know, see that this little bundle of joy has now entered your life, and it is the best feeling in the world. People tell you about all the downsides and the sleepless nights and all that, but, you know, it's worth it, absolutely worth it.
We only got married in March, like this was a bit of a surprise.
I was looking at your ring, it's gorgeous.
It was a surprise, like, wasn't really...
Baby was a surprise, or the wedding was?
The baby. Like, we had the wedding planned nearly 2 years.
We had planned, I think, to get married first, obviously, which we did, but I don't think we planned for it to happen so soon. But I, myself, I think you were probably the same, that we didn't want to be too old having kids either. We're both in our early 30s, so we want to kind of do it now and enjoy them growing up.
Oh, good. Okay, so look, we're about 2 centimetres now. It's come around to the front, and baby's head is moving it. I think I can feel a little bit of hair. I think baby has a bit of hair there, yeah.
I must have been crippled with heartburn.
Yeah, so at least that's the reason why.
Yeah.
The whole way through, Sarah was getting really bad heartburn, and obviously one of the old wives' tale is that a lot of heartburn tends to you tend to have a baby with a lot of hair.
Yeah.
And the few scans we had, I thought myself looking at the screen, I thought like she had hair from what I could see.
I never had heartburn in my life.
You were born with
I had
hair,
a full head of hair.
There you go then.
Yeah, serious head of hair.
She's starting to feel a little bit of pressure. Now she's contracting. We've been moving her different sides. She's contracting 9 there, but she's been contracting like 7, 8 sometime.
I don't pay into places. Not really. Like, no,
just walk in.
No, not that I walk in. I just don't want to. I don't go to places that you pay in. Like, I don't go to nightclubs.
It's just like music bars and stuff.
Yeah, like if you bring me towards that Zico's, is it?
What's that like?
Do you have to pay in?
Mental, but like you're like paying a tenner and you're like that, and then you feel really old, so you feel like.
Yeah. Is it good?
Yeah, it's good if you're 25. Everything's good if you're 25. That's why I have to stay in Donny Nesbitt's where there's 50-year-olds there and you feel like young. Yeah.
I know, I'm too old for nightclub.
Too old. Yeah.
We just have to go down to...
On the prenatal ward, Ellie and her husband Owen are getting ready to go to theatre for their baby's in utero transfusion. They'll never forget where they first met.
We met in London, didn't we?
In Bristol.
Oh, Bristol, sorry. Yeah. He said the blood is nearly ready and that they might have a slot in theatre in half an hour. So I was only ringing you just to say that, not to meet you.
We met on the night out?
Yeah, in an O'Neill's Irish bar. And there was a group of us that night, and there was a group of Irishmen, so... but I was the only one who got lucky. All these years later.
Although this is the couple's 5th pregnancy, it's the first time Ellie has had to go through a fetal blood transfusion.
With rhesus disease, the mother becomes more sensitised to positive blood with each successive pregnancy. So we tend to see the baby getting anemic earlier and earlier in each successive pregnancy. Yeah, I'm thinking, I think I'll stand over that side. Yeah, so machine up here, yep.
The hospital environment is a familiar one for Ellie. She works as an ICU nurse in Crumlin Children's Hospital in Dublin.
So I'm sure this is all fascinating. This is standard ICU day for you, isn't it? Yeah.
So being a nurse, you see some really sad things and some things that you just think, I never want to be in that situation or that position, and especially with children,
The hardest bit for you here is that you have to just stay still.
The things you see, not a lot of people would have seen unless you work in ICU.
You can breathe. You can breathe, but just you have to stay still, because, as you probably heard me saying there, the needle is going to be in a very delicate spot.
I think it does make you just realise how fragile life is, definitely.
Suzanne? Sarah, will you just tell Suzanne it's Jane here, we're about to start. Thanks.
In 1 or 2% of cases, the baby will not tolerate a fetal transfusion, and there's a possibility that during the procedure, an emergency caesarean section might have to be performed if the baby's heart rate slows down. Just there, that's exactly there. Little cramped now, I'm sorry. Take the probe. A needle is placed into the umbilical cord, a tiny space only a couple of millimeters in diameter, and the baby is constantly moving. Just sample 1 for our HemoQ. Sample 2 for the lab.
Working against the clock, the hospital lab must analyse the baby's blood before the transfusion can take place.
We can't wait possibly for hours for a lab result to come back to tell us how anemic the baby is. We therefore pause our hospital laboratory and keep everybody on standby, waiting for the arrival of the blood sample so they can tell us within a minute or two how anemic the baby is.
Suzanne? Sample 1, pre-transfusion. Okay, thank you very much.
This allows us to calculate the precise amount of blood to transfuse into the baby. If you don't transfuse enough blood, you won't prevent heart failure. But if you transfuse too much blood, that can also be dangerous for the baby. So we need constant guidance from our hospital laboratory as the procedure is going on as to how much blood to give and whether we've got to our target level.
Hi. MCV 94. Platelets 2 9. Thank you.
Oh, yes.
When you're lying in theatre, you are thinking, oh gosh, what's happening inside? Because obviously all the doctors and experts in the world, I suppose nothing is guaranteed, so, and they have to tell you the risks, and there are risks obviously doing a blood transfusion, so definitely it's stressful.
Okay, off we go, and hopefully you can go a good speed on that if we can, because we're definitely in a good spot there.
So
I'm very
it's
happy
actually
with
going
that.
in nicely.
Yep. Baby's behaving very well. That looks like an artery below there. Do you want to just take the artery? Yeah. Doing very well. We just need to stay still for about 3 or 4 minutes, and we should be fine. I presume it's a contraction in the uterus. It's just lifted us just now. It's amazing how the movement.
It's incredible.
On a contraction. Okay.
I stupidly didn't really think that it would cause labour pains. But I suppose if they're putting a needle in and they're aggravating the uterus, your uterus is going to contract. I wouldn't say like full-blown contractions, but definitely kind of halfway there.
It's been almost 40 hours since Sarah's waters broke. Midwife Ciara is examining her to see if the long wait to meet their baby is nearly over.
Fantastic. Great. That's brilliant. So you're 10 centimetres. Forgot to deliver that news. And we might just do a little bit of a push down, just see with this next contraction, and we can see where baby's head goes to. Okay.
We wanted Sarah's labour to progress because it had been a little bit slower because the waters had gone for such a long time. We wanted things to progress a little bit quicker.
Down more. Right down, even more. Right down. That's it, well done. Brilliant, okay. And we'll wait. Do you know what we'll do? We're gonna wait. We'll wait the hour, okay?
Right, okay.
And allow, baby's moving when you're pushing. Just if we can allow you to have that extra bit of time where you're not using all your energy.
Okay.
Okay. And just let baby's head move down.
After an hour, midwife Melissa starts her shift. and her first job is to get Sarah pushing.
It's lovely to meet you.
This is Sarah and Dara.
Come on, go on, push here. That's it, very good. Keep it coming, 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 keep it coming. Excellent, well done. Very good.
After a while of pushing, I asked her to go on the side just to try to help the baby to rotate into a good position.
Keep it coming, 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 keep it coming. Okay.
But this unfortunately didn't help.
I was pushing for an hour and nothing was happening. And I think then I was starting to get upset with myself. I was like, I'm doing this wrong. I'm not doing it well. And, you know, I was taking it to heart. And I was exhausted at that stage.
The head hasn't really come down much.
What do we do? What do we do?
Usually, like after an hour of pushing, I'll get the doctor just to see if we can do anything, just to, especially she needs to rotate into the right position, this baby. I think she's facing sideways. I decided to inform my senior midwife that I needed a doctor review just because I was having a few concerns that the baby was getting tired, so I just wanted one of the doctors to come and have a look. Slow deep breaths, Sarah, slow deep breaths.
You're pushing very well, okay? I think baby needs some help. It's just the baby's head position.
Yeah.
It's just, baby's trying hard, it's just on a little bit on the tilted angle. So we may have to apply a kiwi cup or a forceps. I have to just see, we'll put you in the position, we'll ask you to push again and see if the baby's head comes out. The kiwi cup may pop off because of that swelling. I'll push you in the position and examine, and then decide what we can try. Is that okay? Yeah?
Right, you ready? Many a red sun will set, many a blue moon.
That's a song, yeah. One.
What is it, a song?
Yeah, that's a song, yeah.
Oh, well, I don't know that.
Yeah, don't worry about that. Either one. Hi,
Right, Ali Hakim.
Hello, Ali Hakim. Ali Hakim.
Get away!
Hello, kiddo.
Oh, Jesus.
Hello,
I'm
kiddo.
sure sorry to see you so happy, because what I got to say will make you miserable. I got to marry Will. That's the way it's wrong.
Good morning.
Hiya, nice to meet you.
Nice to meet you. Peter is my name. I'm one of the anaesthetic doctors.
Yes.
Ellie has been admitted to Dublin's Coombe Hospital. She had a second blood transfusion in the Rotunda, and now it's time to deliver her baby early by C-section.
Ellie, you're having a section today?
Yes.
That's your first section,
Yeah.
right? And you have 4 children?
Yes.
2 of them were delivered with a forceps and 2 non-vaginal deliveries. Did you have?
The doctors feel it's safer to deliver the baby 6 weeks early, rather than have it become anemic again.
I didn't want to do another blood transfusion, and I think they thought at 34 weeks it was becoming a bit more risky to do another transfusion.
Thanks very much.
See you upstairs then.
Thanks
Okay, all the best.
Bye.
Then they rang me on the Wednesday morning after they'd had their big talk, all the doctors together, and they rang me just to say, yeah, if you can come in tonight, we're going to deliver you on Thursday morning.
So Ellie, they're just going to pop a catheter in. Now you won't feel any pain. You might feel touch but no pain. It's kind of a funny, dissociated sort of thing.
You all right?
Yeah. There was definitely a few evenings I came down to you during when we chat at the kitchen table, and I definitely felt like I'd rolled a dice. Yeah, definitely.
I'm trying to avoid those vessels, yeah.
A few times we were sort of saying to each other, God, if we'd known all this was going to happen and the potential risks, would we have gone ahead at that stage, knowing what we know now?
The head is down, so it's nice. Now suction when you're ready, thanks. Okay, and fundal pressure now.
I think it's just you never know with life. That's the problem. That's why people have babies in the first place.
That's great. Ellie, we're about to have your baby. The quick way. Oh, gorgeous. Little man.
Well, boy, that's what you thought.
And in ICU, you've seen so many emergency situations. It was all very controlled. There wasn't an emergency. I knew the consultant neonatologist was there. because I've seen so many emergency situations, I could tell it wasn't a case of an emergency. Does that make sense?
That's great. Thanks very much.
Congratulations.
He looks really like Oscar, actually one of our other sons.
We haven't done a weight or anything yet. We'll do that when we get him down to the baby unit.
Definitely in that situation, I find you're looking around nearly, looking at reactions and how people are in terms of their facial, or do they look stressed, do they look, whereas it didn't, it was all very calm, which was great.
Yeah, that's good.
Looks great.
Did you get a photo?
Yeah. It looks really like Oscar, actually. Oh, sorry.
Oh my God. Everything is good here. Okay. We're just going to move on to the tubes.
Yeah, that's great. Thank you. Yeah.
So the next conversation that always happens after some very complicated pregnancies, what happens the next time round. We know that it's very likely that the baby, a subsequent baby, would have a similar, if not more severe presentation of the condition, and that's difficult to face into.
Ellie and Owen made the decision to have a tubal ligation to prevent further pregnancies.
The thing is, you don't have 3, 4 kids unless you like having them. So, but at least with 5 kids, there's a good chance of quite a lot of grandkids. So.
Get to meet your mum.
Just have to get another dog. No, only joking. No, 5 is a great number. Yeah, 5 is just perfect.
Let's see you in a bit. Cheers, thank you.
A very special occasion at the Rotunda, celebrating their 18th birthday. Connor and Amy and Cian and Rory and Derval Cassidy, who are, of course, our famous Rotunda quintuplets. We know that quintuplets are tremendously rare. Ireland has only one set of quintuplets, and they're here today with us.
Having 5 25-weekers born at the same time and being cared for in the neonatal unit was always going to be a challenge. Statistically, babies that are born between 25 and 26 weeks back in 2001, the survival rate was 50 to 60%. So the fact that all 5 survived and all 5 are healthy and well is a huge achievement. Quintuplets is a story that any of us that were involved in caring for them will never forget.
Do you have a baby? Okay, come on. Go, Sarah. Deep breath in and push all the way down into your bum. Come on. Big push. Keep pushing, keep pushing. Bring the legs up to your chest. Yeah.
It's the baby's head. It's going to
You're going to feel loads of pressure. It's completely normal. But you push with the pressure. Keep pushing, Sarah. Don't be afraid.
Good girl, go on.
Come on, go on.
Back in the delivery suite, Dr. Samaya is using a kiwi cup to help deliver Sarah and Dara's baby. Dara is finding it hard to watch.
Keep it coming.
It's quite difficult from the dad's point of view, especially when it's an instrumental delivery, because they don't really know what to expect. Everything looked very, very dramatic.
Keep blowing.
I was starting to panic a small bit at that stage. Obviously, I didn't like to see my wife in pain. She'd gone through a hell of an ordeal over the 27 hours, and I was thinking of my daughter then as well. Obviously, her heartbeat started to drop. So it was all just getting a bit worrying at that stage. We'd gone this far in 9 months, and it would have been just heartbreaking for anything to happen.
The head is out with the next contraction.
Baby doctor. Gloves just over the feet.
We're gonna see her. Okay, it's coming. You ready? Legs right back to your chest. Keep pushing. That's it. Blow. Hello. Congratulations, guys. Congrats. Oh my God, she's a big girl. Have a look at her. Oh my gosh.
No, go.
Yeah. Just 1 second, the sharp
Okay.
Congratulations.
Okay.
Yeah, it was just amazing to see her that first time. Like, I seriously, when I heard that first cry,
Yeah.
I think there was a bit of like a couple of seconds wait, so it felt like an eternity, but once she gave that initial cry, it was just brilliant.
I remember the doctor explaining what she was going to do, but not really taking it in, and the next thing was just like pop, and the baby was there.
Dara, do you want to cut the cord?
Did you want to cut it?
Oh my gosh, she's so beautiful.
Just in between the two.
Here?
Yeah, there.
Oh, my hands are slipping.
Bring her over, say hello to the baby for a second. I have her.
I'm sorry, I can't do it. I'm afraid of coming.
She looks like Dara.
It was funny, the midwife was like, oh my God, she's so like her daddy. And I was like, oh my God, 9 months and all this I've gone through and now she looks like him.
Oh, Jesus, I love you so much.
Like when she looks up at you and she's giving a gap, like you just completely, you know, do it again tomorrow without a doubt. Maybe not so soon, you know. In a while we'll do it again. But
I have to agree to it as well, so let's see what it is.
Oh God, 8:15. She is 4 kilos 05.
She'll never forget her roots, because obviously I'm from the country, so I'll always have that in her. She can follow Kilkenny and hurling, Dublin, the football. I think that's probably a good balancing act.
so she's not far off. She's not far off 9 pounds then.
Yeah.
Yeah.
I know.
But she'll still have a big double accent.
She might talk properly like me, you don't know.
She'll be like, Dad, why do you talk different to everyone? We'll get you a Dublin jersey too.
No thanks, I'm alright. Definitely don't want that in the TV.
When it's a full moon, it will be like the hospital will be crazy. It's actually real. Like it's real, and it's not only in Ireland. I can assure you, like it's the same in Italy as well. Like if it's full moon, you just need to pray like that the shift will be okay.
Down to the left here.
Arriving into the delivery suite, expecting their first child, are Laura, an air stewardess, and Raz, a waiter. Both originally hail from Romania.
Do you know any cool moves?
Any cool moves? See that poster there?
Yeah, I saw.
These are all very good. But
That's the coolest one.
That is the coolest one, yeah.
I wanted to give birth natural, without any injections or medication or. So the contractions will be stronger and more painful, or like our mothers, be natural, everything.
Old fashioned, I'd say.
They probably will progress a little bit, but they're already doing a very good job of opening out the cervix.
I didn't want to hurt the baby. I read books about the epidural and taking medication during pregnancy or in labor, and this might hurt the baby.
Come on in.
Hello, how are you?
Hello, how are you?
She had a few concerns about getting an epidural. Thankfully, getting epidurals is lovely and safe, and it's really safe for your baby. She didn't want to get it, and that is perfect. So Katie is going to take over from me, okay?
Okay.
But I'll be coming back in later to see your little boy.
Yeah.
Good plan.
We met in 2014, in work. We used to work in a restaurant industry. She was a receptionist, I was a waiter.
Any flowers?
I was all day here with you.
It's Valentine's Day, no. Oh yeah, I forgot.
For me, it was easy. It was love at first sight.
This is the most romantic present, a baby.
Oh. Now I'm happy he's a boy.
Really? Oh
Yes.
You know what women have to endure.
Exactly, before she wanted a girl. And she saw what's happening and she said, no, I'm glad it's a boy now.
I don't want her to suffer.
I wanted a kid. I wanted a baby. In the beginning, she wasn't very sure she wanted one, but I keep pushing her, come on, it's time. It's like, look, this time.
I think your jobs are harder than mine. Working in an airplane with drunk people and...
Oh my God, yeah.
Hats off to you, you know.
I work as a cabin crew. To have a baby meant to stop flying, so I love to fly. That's why I wasn't prepared to have a baby.
And especially when you have delays and it's not your fault. They don't understand that.
People get very frustrated, don't they? And they take it out on you. Yeah.
I love aircrafts. I just love
Sometimes
fly.
just sit in the garden just watching the planes take off
Yeah.
in the back.
I go to the airport and watching the aircrafts.
Yeah.
Oh, shit.
So I'm getting, whatchamacallit, slide ropes. Oh, lovely. Slide rope there. That's the bottom of my bed. And then that.
Although I don't think I could get up every morning and be looking at myself in the mirror.
Oh no, I'm not going to. I'm only going to get one mirror in the middle, kind of maybe up high.
Okay.
And then in the boys' room.
Do you not have them on the ceiling, Louise?
Oh yeah, everywhere. Oh my God, can you imagine?
That would be nice, actually.
Emma and Martin are in outpatients for a milestone checkup with their son Nathan. 7 months ago, baby Nathan was delivered in the Rotunda at just 25 weeks gestation after mum Emma was rushed from Ballinasloe Hospital. Weighing less than 900 grams, he was gravely ill. His sudden arrival was a shock for Emma and her partner Martin, who had been together for only 7 months.
Lights blazing, gunning it up the road. The on-call doctor comes in, checks me, and goes, I'll be honest with you, baby's feet are actually out of the cervix. He's kicking out of the cervix. He was that low down. And I was like, what does that mean? She says, very high chance baby's coming tonight.
He's looking great. I feel a bit better now, but it's a bit, you know, when I heard about the ventilator this morning, it was like, oh, kind of the end of the world, but I'll admit I had a bit of a breakdown. That happens though. But you're expecting setbacks, but you just have to think logically about it. And then I was saying to myself, see, I suffer from mental health anxiety, and I said, am I cut out to be in this position? I doubted myself. Because I should be there to support her and him, but I'm kind of finding it tough. Like, it's just the whole thing is daunting. Like, I'm thinking too far ahead of myself, to be honest with you. So, I mean, I'm delighted with his progress, but it's still, I can't even think. When I'm home, it always comes back into my head, even when I'm enjoying myself, I say, oh, he's in here. It's not easy.
The thing to remember about neonatology is that we're not really just only caring for the baby, we're caring for the whole family unit, and that's the whole premise of family-centred care, and that we provide care to the parents as well as the baby in the intensive care unit.
Nathan spent 6 weeks in the Rotunda's ICU and a further 7 weeks in Galway Regional Hospital.
Straight into the mouth.
Today he's back in the Rotunda for the first time. The team want to check his heart function.
Nathan would be 7 months or 4 months corrected, considering when he should have been born.
She's born on the 22nd of September, so.
Yeah, and weight-wise, where he started off at £1.15, he is now a stone.
Officially today we weighed.
Officially today he was weighed, and he's a stone in weight.
So he's
huge.
7 times his birth weight.
Yeah.
Look at you.
It's like, I think I know you.
Ah, do you remember me? Huh? You're a buster. You're a buster.
I'm just checking the heart at loads of different angles. And I'm basically making sure that there's no little holes in the heart, which we know from before that there isn't. I'm making sure that the heart is pumping well, and at the moment everything is looking good.
No.
So what is the noise indeed?
That's your heart.
Yeah.
It's my heart as well, I think, at this stage.
Is it?
Yeah.
It makes me laugh, right? everything he put us through in 13 weeks, and it's the slightest sniffle that makes him panic now.
Isn't it? All that, like, when you have him home, it's just like...
I think it took a few days for it to kind of kick in that, like, it's okay. We're good.
What size, what was he in comparison to?
Oh,
You're looking
like,
back.
I mean, if you look, I'd say he was barely his torso. If you were, you know,
I mean, it's hard to imagine, like, but, you know, looking back. But... Well, I think I'm coping well, but I've had a few panic attacks.
It's Daddy. Hey, yeah. It's Daddy. Hey, yeah.
He's getting there. Like, I mean, considering the anxiety issues he has, he's doing marvellous.
Thanks very much.
Thanks a million. Thank you so much. You were great.
Thank you.
Oh, it's so nice. We'll see him again at some stage.
Emma and Martin are going back to the intensive care unit with Nathan for the first time. It's a place of heavy significance after a difficult 6 weeks spent there.
It was just like, oh my God, my heart was pounding, because it's just like the last time I had to do this route, we couldn't bring him home.
Yeah. This is a bit weird coming up here on our...
Hello, Nathan. How are you? How's he doing? Grand, he's perfect. He's absolutely flying. We just got him weighed, so he's over a stone in weight.
And it was so nice to see familiar faces again, and they were talking to him, and
delighted.
couldn't get over him because, like I said, he was barely a couple of pounds the last time they would have seen him.
Stop snuggling into me. Talk to people. You have to talk.
How are you? Welcome back.
It's lovely to see you. You're brilliant. You're like a role model for all the little guys inside us.
It's like his mother asked me recently, she says, just out of the blue, she asked me, she says, now that he's home, he's safe, he's big pudgy baby, can I ask you something? I says, go on. And she says, did you think he was coming home? And in that moment I had to think about it, and I said, I'll be perfectly honest with you, I thought we were planning a funeral. And I will be honest, I thought we were going to bury him back then, because there was so much wrong, and he was so tiny, and realistically he was just barely past viability. So it was just, I suppose I did think at the time, and then I kind of closed it off and was like, don't think about it, because if you think about it, it's going to happen.
Yeah,
you're going to make yourself sick thinking about it. So then now when he's like that, and he's big chubby baby and he's smiling up at you, I can say to myself now, oh my God, you're a miracle, because I really did not think we were going to get to this point. I honest to God thought that was it.
Are you okay?
For the parents and for just us going up and down, and I know it's what it feels like. You're not kind of away, you know, and it's kind of like you're given kind of hope, but then again, anything can happen, as I said.
He's all in one piece, you know.
Sorry.
You look in there and you see those small babies and you kind of go,
They have a long road ahead of them.
We were there, and God, we're here with you, because we were there and we saw the surgeries and we saw the heart issues and the sepsis and the transfusions, and we went to pieces so many times and fought like cats and dogs when we got so angry with the situation that shouting at each other was just the easiest way of dealing with it. We've been there, and it's the hardest road you will probably ever do, but it is worth it in the end.
I think it's a mix of the teeth and hunger.
Ah, Jesus, he's absolutely gnawing on you.
Ooh. Dă-mi un pic antiperspirantul și parfum. Serios. Da. I put makeup. I was with makeup on and my hair was...
That's why we were late in the hospital, 2 hours. So like she had her hair done, makeup on, everything. Unde ți-ai antiperspirantul?
Pe acolo.
În asta mare? Aici?
Caută-l. I didn't want to look like an exhausted mother.
Ce este?
Shampoo.
Este șampon?
Yeah. I wanted to be pretty for my baby.
Anything nice now? Take another nice one.
That one's nice. It's
But
all
it-
right.
but
It's
it's not.
no,
It's
it's
that
not.
one.
It's there.
Laura has been labouring for 5 hours. She's coping well with her pains by moving and keeping upright.
Katie told me that it would be easier because of the gravitation.
Gravity work for her.
Gravity.
Yeah. There was a panel there with a few positions that she can sit. She chose this one. It was like the most comfiest for her.
I might take off the underwear, okay? Because it sounds like you're kind of getting ready to start pushing very soon.
Yeah.
So if maybe we just take off those underwear, because you can't have baby in your knickers. We need to take off. We need to take off the underwear.
Really?
Baby needs to come out.
How high is the head down?
It's kind of -1.
Right, okay.
There's an anterior rim there.
Right. And she is a prime up, isn't she?
Yeah.
But she's coping well. She's no epidural or
No,
anything?
she's coping with it so well.
Right, okay.
I tried to talk to her into taking something to the epidural. She didn't want to listen to me. Like, ease your pain.
Yeah, the
Normally
labour
everyone would
was
like to
so
ease your
bad.
pain. She didn't want to. She's my hero for that.
And blow. And another little push now.
The whole experience was absolutely new for me and a little bit shocking, I'd say. I didn't expect to sit there until the end. It's not common in Romania. All the hospitals they have a policy. It's only the doctor that sits in the room and the nurses. It's very important for the father to be there when the baby comes out, because not the doctor is the father. It's you that's the father. You have to hold him in the arms. No, first, not the doctor.
Blow, 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 blow. And another little push.
He's big.
Little push again. Oh, that's the head out. Well done. Let's see. Hello, Stefan. 11 minutes past 6. Now, just to wait till the head rotates around, okay?
And now?
Just breathe until the next contraction comes, okay? Give it a little push there and see what happens. Small little push. Blow. Push. Hello there. At 13 minutes past 6. Now you just come back a bit. Say hello to me. Oh, congratulations.
You can describe this.
This is the most magical thing ever.
Yeah.
When you hear him and when you actually see him and feel him on top of you.
What's wrong?
Really cute. Nothing is wrong.
What do you think of him?
I didn't imagine him like this, but he's so beautiful.
I don't know what to say.
Speechless.